We're live now, Amalayo.
I need to know if we're ready to start.
We're live. We're live. You can
All
start
right.
talking. We're
All
live.
right. All right, ma'am. All right. Ladies and gentlemen, distinguished guests, esteemed speakers, and delegates from all across Africa and beyond. On behalf of the Africa Trauma Care Alliance, the nonprofit arm of the JARS Group, it's a great pleasure to welcome you to the fourth edition of the Africa Trauma Conference, themed Pathways to Wellness and African Global Perspective. Drum roll! Wherever you're joining us from, I need to see a lot of buzzing going on in the chat room. Send where you're coming, where you're joining us from. Say hello to people who's in the same vicinity as you, or the same continent, the same country, the same nation as you. We want to know where you're joining us from. We want to hear you hello. We want to hear you say hello to us in your dialect, in your language. However way you want to say hello, please go ahead, say hello to us. Ekaro, that is my own language. Ekaso, I don't know where you're joining from, whether it's afternoon, it's night, it's evening, it's morning, whatever time zone you're at. I'm saying hello and welcome. We are honored to have you join us today, and we appreciate your commitment in improving trauma care on our continent. My name is Omolayo Oyawoye, and joining me today will be Esther Olayinka Beno. You're going to be hearing a beautiful voice shortly. Now, today and tomorrow, we gather as a community of healthcare professionals, policymakers, and stakeholders united by a shared vision to provide accessible, equitable, and quality trauma care for all Africans. Over the next 2 days, we will engage in thought provoking discussions, share best practices, and explore solutions to address the complex challenges facing trauma care in Africa. A few exercises before we get started. Now, I want to still see you typing. So if you join on Facebook, YouTube, Instagram, LinkedIn, whatever platforms you're joining us from, tell us your city and send us a picture of you. And would love it if you show us some Africanness this morning. Share with us, your scarf, your kente, your adire, your ankara, your big earrings, whatever it is that shows us that you're an African. Send us as a picture, an image on Facebook, Instagram, LinkedIn, and whichever platform you're joining us from. All right, make sure you're properly dressed for a picture, and if you aren't, get your water, find your nearest restroom, and keep your devices powered so you don't miss a bit. And then you can send a picture of your conference seating arrangements. Would love to have all of these things. Tag us, want to see hashtags, trauma, Africa Trauma Conference, any ways that let people know what you're doing at the moment. Now, say hello to someone from your city again. If you are from Nigeria, where are all my Nigerian trauma care professionals? Say hello, my Kenya trauma care professionals. Where are you this morning? I want to see you saying hello. If you're from Ghana, from Cameroon, from Zambia, wherever you are on the continent, say hello to one another in the chat room. I mean, you can never tell. This may be a beginning of a beautiful connection. And honestly, someday, I've never been to Kenya, but if I come to Kenya, I might just be looking for you. You might just hear my knock on your door. All right, a beautiful connection it will be. So for you and everyone else logged in live today to guide us through an interesting time of intellectual and heartfelt exchange, here are a few house rules. All right, be kind, speak with respect and empathy. All right, no vulgar language, please. Listen actively and respond thoughtfully. Let's have meaningful convos. All right, now trigger warning: Avoid language that might trigger or re-traumatize others. I mean, we're professionals, we know all these things. This is just a quick reminder. Respect boundaries, but considerate of others' emotional well-being. Stay on track, right? Let's focus on trauma care and related themes. Now, no self-promotion, no promoting yourself or your organization. Ensure stable internet so as not to miss anything and stay away from noise as much as you can. Listen to moderators and organizers to keep discussions smooth. Respect report concerns. So just in case you're experiencing any difficulty joining, hearing, or seeing us, let us know. Let's make this conference a safe space, all right? And as we get into the conference proper, please tag someone you know should not you know shouldn't miss us in the comment section. So tag their Facebook link, tag their Instagram profile. Anyone you know should be here. Tag them and let them be here today. Now, it could be a friend, a colleague, a neighbor, online buddy. Don't let them miss this life-changing opportunity, all right? We want to see you smiling. Send your pictures, send your pictures, send your videos of what you're doing right now as you're joining us, all right? Now, to move forward, I now invite our Global Operations Director of the JAS Group Worldwide and Conference Coordinator for the welcome and acknowledgement, Mrs. Adebimpe Oshinuga Icho. Over to you, Mrs. Adebimpe.
Okay, I think that Mr. Adebimpe is not here right now. Can we hear me? Can we hear me, please? Okay, all right. So because she's not here, I will. She's just having some technical difficulties right now, but I'm sure she'll be back soon. So I will just run us through what we have planned between today and tomorrow, which is what she was going to do. So if you have that up, I don't know how many of us have the agenda yet, but if you do, feel free to look through it. We have amazing lineup of presentations and conversations that are ongoing. And we'll begin from today. So first up, we'll have our keynote address, which is meant to be taken by the Chief Medical Director of the University College Hospital, Ibadan. But he'll be ably represented by Dr. Ajibola Oladiran, who will come up soon, and we'll get to meet him. And followed by him, we will have other presentations coming up. Prior to Dr. Ajibola, we would have Dr. Marino, who will come on to give us the welcome address for this conference. And then we will next, after that, we'll go into the presentations from our guests who have taken time out to prepare their presentations and are ready to feed us with insights and perspectives for our conference today. So right after Dr. Ajibola, we'll have Dr. Nayet, who happens to be celebrating her birthday today. We say happy birthday to you, ma'am, and we look forward to hearing what you have for us today. Dr. Nayet will be speaking to us on the pathway to trauma healing in Africa. Then after her will be Dr. Fola Rogers. Sorry, Dr. Fola Rogers was speaking to us on the pathway to healing in Africa, while Dr. Knight was speaking to us on the cultural competence in trauma care within the African context. After Dr. Fola, we would have Mrs. Bukola Ainde, who is going to speak to us on Ms. Bukola Ainde, who is going to speak to us on the Diary of a Special Needs Moms Initiative. She's going to speak to us. I'm sorry, I'm kind of losing touch with the topics, but this is Bukola Ainde will come up next, and after her, I can't seem to find a topic. I'm so sorry about that. After her will be Jumoke Dada, who will be speaking to us on family trauma. And then after Ms. Jumoke Dada, we'll have case studies from our students who have gone through their own journeys of training as trauma care coaches, and we will share their experiences, excuse me, with us on what they've been able to do so far based on their training. Okay, Ms. Adebimpe is here now. Welcome, Mr. Adebimpe. I hand over to you. Okay, she's off again. Sorry about that, people. We are having a lot of technical issues. So after the case studies, we'll go into Dr. Merino will then come up to unveil a book, the ebook that she has come up with, and that we are all excited to receive. Some of us have been trained and have experienced a touch of those stories. And if you want to be part of this conference, you are definitely going to get a free ebook from Dr. Merino if you're patient enough to receive it. So wait for that time when the unveiling will happen. After that, we'll take a break and then we'll come back to the other presentations that we have for the day. So please stay on. There's a lot to come. And we hope that you will all have a wonderful time of learning and insights from attending this conference. So before we go on though, I guess Ms. Bimpe still trying to sort out our technical issues. I would like us to try right now. I don't know, maybe this is your first time of attending this conference. This is the 4th edition. If you want to, or if you're seated comfortably, I would like us to practice some deep breathing together. So if you're not seated comfortably, I'd like you to find a seat and make sure you are relaxed. If you're seated in a relaxed, make sure your shoulders are dropped. Make sure you're very relaxed. And then I'm going to tell us the process and then we're going to do it together. The first thing we're going to do is breathing through our nostrils, of course, for 5 seconds. Hold it for 6 and then slowly breathe out through your mouth slightly for 8 seconds. So it's like you're blowing into a balloon. I'm going to say it again. You breathe in for 5 seconds, you hold for 6 and breathe out slowly through your mouth for 8 seconds. So I'm going to do that, and wherever you are, practice with me. So are we ready? Wherever you are, breathe in slowly right now for 5 seconds. Hold for 6. And breathe out for 8. So let's try that again. Are we ready? Hold for 6. And breathe out for 8. So drop your shoulders and get ready, because right now I invite the president, Jazz Group, leader of the Africa Trauma Care Alliance, and the host and chairperson of the Africa Trauma Care Conference 2025 to give the opening remarks. Professor Merino.
Yes, hello, hello, hello. Thank you so much, Esther. I am so happy to see today. Thank God for all of you from across the continent who are here to participate. I thank you for tuning in. So call your friends, call everybody. This is our thing, and we are here to showcase what can be done on the continent. We're here to showcase what is necessary, what can be done. I welcome you to this edition of the African Trauma Care Conference 2025. I am honored to host this gathering and to welcome delegates from across the continent and across the world. Your presence reflects a shared commitment to healing, to justice, and to the future of our communities. This conference is held in collaboration with JARS Education, whose partnership strengthens our mission to expand trauma care, train leaders, and build sustainable systems across the continent. In Africa, we say if you want to go fast, go alone. If you want to go far, go together. This conference is our journey together. Every nation here carries both pain and possibilities. We cannot ignore the realities before us. The Tigray War is still happening right now in Ethiopia. This famine in Kenya, the challenges that we have in the kidnappings in Nigeria, and countless forms of violence and displacement and poverty affecting our people. These are not headlines. They're wounds that we carry in our bodies, and they don't even have to be big ones. It could be the traffic on the streets of Lagos, the traffic jams, et cetera, et cetera. It could be not having light and not having water and not having the basic infrastructure. We carry these wounds in our bodies. We carry them in our families. We carry them in generations. Yet, Africa also has carried the wisdom that teaches us that no matter how dark the night, that the sun will rise again. Our ancestors understood trauma long before the world, the word existed. We talk about trauma, but we understood this long before that word existed. They created rituals and songs and storytelling and communal care. We've been healing ourselves on the continent for thousands and thousands of years. Healing was never a luxury, it was for survival. The Yoruba concept kadasile kawatusha, to lay down what is broken and rebuild, to capture, to put down what is broken and rebuild from what is necessary. That captures our task today. Trauma care is not only clinical, it is cultural, it is spiritual, it is collective. Let me say that again. Trauma care is not only clinical, it is cultural, it is spiritual, and it is collective. True wellness in Africa requires more than treating individuals. It demands that we restore communities and repair systems. This conference is about integrating trauma care into health, education, policies, leadership, and everyday life. Sustainable development is important if traumatic stress continues, to be unchecked. So today, we remember that a tree can't stand without its roots. It's an African proverb. Our roots are strong. Our culture holds solutions. And that is what today's about. Our culture holds solutions. We are not only healed because of all the Western solutions, that we also are contributing to healing, that we are also contributing to our own strength. Our people hold resilience. We're not starting from nothing. We are building on deep wisdom that has been here for eons of years. Over the next 2 days, we will learn from one another. We're going to challenge old models. We'll tell the truth about our pain and design an African future of healing. We will move from trauma-informed to trauma-responsive to trauma-transformed systems. We want trauma-transformed systems. To every delegate, to every policymaker, to every educator, to every mental health professional, to every advocate, to every parent, every individual that is in this space today, thank you. One finger cannot lift a stone. It will take all of us, all the fingers. This is not just a conference. This is a movement rooted in our history, grounded in our culture, and focused on our future. Thank you very much. Please take the time to relax and enjoy all the speakers. Thank you. All right, let's bring up our Esther. Sorry about that. I can't. All right, there you are. Amalaya, are you there? Well, my
Yes, I am.
MCs. Okay, there you go. You can take it over. Thank you.
All right. Thank you so much, ma'am. And now for the first keynote, representing the Chief Medical Director is the Head of Department, Orthopedic and Trauma Surgery of the University College Hospital, Ibadan, Dr. Ajibola Babatunde Oludiro. Over to you, sir.
Hello, good morning.
Good morning. Welcome.
Good afternoon. Can you hear me?
We can hear you. Thank you so much for coming. You take it over.
Hello.
Hello, we can hear you. We can hear you.
Thank you so much.
Yeah, you're welcome.
I just want to know if you can hear me.
We can hear you. Welcome to the stage. Take it over. Yeah. So you can go ahead with your presentation. Go ahead with your keynote, please. Oh, is that network? I think that's I think that is.
I'm not sure if it's my network, but I can barely hear you.
Yeah,
I'm trying to share my screen so that I can start.
You can start, please. Go ahead and start.
I need a bit of feedback to know if I'm audible and clear so I can go ahead.
You are audible and clear. Can you hear me? You're audible and you're clear. You can go ahead.
Hello, good morning.
Good morning, Dr. Oladiran. You can go ahead with your keynote, please. Okay. I think it's his network. Dr. Oladiran, are you there? Ay. Okay, I think what we're gonna do is we're going to remove him from the stage for right now. Dr. Oladiran, are you there?
I can hear some feedback, although the voices I'm hearing are not clear, so I will go ahead and hope that I am audible. So I will be talking about cultural competence in trauma care within African contexts as part of this conference on pathways to wellness and African perspective. I'm Ajibola Oladiran, an orthopedic and trauma surgeon. So my presentation will have a slight trauma bias, although I will try to be a bit more wide-ranging in my covering. Cultural competence involves more than just awareness, and it includes humility, responsiveness, and partnership. It's the awareness of an individual that is part of a culture with which it needs to interact widely, and it needs to be humble enough to know he is part of a whole. It needs to be responsive enough to know that his actions affect others and the actions of others affect him. And partnership involves realizing that as part of a whole, it needs to interact with and respond to other members of the community and the society at large. For trauma care specifically, we need to interpret the patient's suffering through the filter of the patient's culture and to build trust so that the patient is able to accept and trust our care and be willing to receive what our skills are able to offer. It's important to note that a one-size-fits-all approach never works. So it is in every aspect of care, whether we're talking about physical trauma, emotional trauma, psychological trauma, a one-size-fits-all approach never works, because for the person who has broken his left hand, for one person, the problem is essentially cosmetic. For another person, the problem is affectation of his livelihood, because a musician who plays a string instrument needs his left hand to fret, and that requires dexterity. For another person, it's inability to dress themselves up. For another person, it's loss of the ability to be able to cater for their family and prepare meals and do self-grooming. So the impact of the injury varies from person to person, and this needs to be interpreted based on the culture and the person's individuality. We know that the burden of trauma is high, from road traffic injuries to conflict, gender-based violence, which have a more intensely emotional component, natural disasters, and man-made disasters, which again have a more wide-ranging effect on the general population. And whether the trauma is physical, which involves an individual or a group of individuals, or it's social, where it may be more subtle and less obviously defined, or historical trauma that cuts across several generations with intertribal clashes, scarring several families down several generations. It's important to note that whatever the case, biomedical models, that have been developed globally often overlook the local realities, and wholesale importation of global biomedical models never work completely in local realities. And in the African setting, we need to keep this in mind while we are extrapolating these models to our local realities. A very strong mindset that cuts across most African cultures is the concept of Ubuntu. I am because we are. The individual exists as part of a whole. He exists as part of a community. So regardless of the specifics of the individual's personality, it cannot be viewed or interacted with outside of the community of which he is a part. And it's important to know that whatever the nature of the trauma, it ripples through families and through entire communities. One person being affected by one form of trauma or the other affects the family, affects the caregivers, either because of the fear that one person is susceptible to some form of trauma, and the worries that it may mean that the rest of them are also susceptible. If one person has been attacked, then other people are also prone to attack, or the fact that the person who has suffered some form of trauma has lost the ability to contribute his quota to part of that community. So a family's breadwinner suffers trauma, then the family's income reduces. Or a tribal chief undergoes some form of trauma, social, psychological, emotional, physical. The entire community has lost a leader. And these are things that we need to keep in mind while we're looking at trauma and healing. The healing process must necessarily be a collective process that is inclusive not only of the person involved, but of the social and the family structures around him, so that the assessments and the treatment can be holistic. Of course, as mentioned, trauma has spiritual and symbolic dimensions, and it's important for us to note that the perception of a lot of cultures and some religions that believe everything that happens is an act of God often tends to view trauma as some form of retribution for actions or sins, if you may, committed by the person, and that necessarily puts an increased emotional burden on the person who has undergone trauma. So not only is the person a patient, either of physical or psychological trauma, he now becomes a victim of the circumstances based entirely on the perception of the trauma. And rituals and cleansing rites are often a part of healing. So it's important to keep this in mind and to allow reasonable leeways for people to express their faith and express their beliefs as part of the healing process. So we need to be able to bridge the spiritual and medical understanding of the patient. And I am of the very strong opinion that faith and medicine are not mutually exclusive. I believe they're complementary, and we need to be willing to give our people, our populace, the leeway to have this aspect of their care thoroughly explored. It's interesting to note that even till date, modern trauma systems are still built on colonial frameworks, and we need to understand that adaptations to our local realities need to be consistent and ongoing. And we need to recognize and respect the indigenous healers that are part of the community so that we can foster collaboration rather than competition. To focus a little bit on physical trauma, with which I am a bit more conversant and comfortable, I would suggest that part of decolonizing care will be community education, so that the basics of basic life support and cardiopulmonary resuscitation are taught to as many people as possible. It should be taught in schools. Students and teachers should learn BLS and CPR. Every uniformed person that wears a government-issued uniform should be taught the basics of life support and CPR. The military, the police, civil defense, road safety, customs, everybody that puts on a uniform should have basic life support and CPR as part of their basic training. It's also important that as many people in the population as possible be given the basic knowledge of safe means of retrieval of victims from sites of trauma and safe movements of trauma victims, so that the injuries are not compounded during the transportation process. Seizures are a condition that evoke very strong emotional and spiritual responses, and people need to understand that it is a basic manifestation of brain dysfunction, and we need to interact with the physical manifestation to save the person's life while attending to whatever other perceptions later. A lot of people believe in sticking things in the person's mouth and preventing the teeth from clamping. A lot of local beliefs that we grew up with in this part of the world, and many times more harm is done than is necessary. But even worse than the seizure itself, many times, is the stigma that goes with it, because a lot of people believe that seizures are contagious, which is entirely untrue. So the victim not only needs to deal with the medical condition and the injuries sustained, but now going forward, they now need to deal with the trauma of social stigmatization, and this needs to be corrected. Drownings are particularly important because a lot of people can be saved if the initial rescuers know basic life support and CPR. A lot of people who are pulled out of water can be saved by CPR. So it emphasizes the point that as many people in the population as possible should learn CPR. And I would also like to emphasize respect for knowledge and skill. Permit me to cite an incident that happened not too long ago. Someone collapsed at a social event being held in his honor. A doctor in the crowd started to perform CPR, And he was pulled away with shouts of, you are going to injure him, don't break his chest. And they literally physically pulled him away and interrupted the CPR, bundled the person into a vehicle, and by the time they got to the hospital, he was dead on arrival. Whether or not the CPR would have saved his life, we will never find out. But then there's that pain of what could have been. And the person who was performing the CPR that was interrupted now has to live with the emotional trauma of not only losing a friend, but of wondering whether or not he could have saved his friend if his CPR had not been interrupted. And that simply emphasizes the need that knowledge is one of the most important things that needs to be spread all over the community so that people know what needs to be done and people defer to those who have the knowledge. One good example that has worked very well in Nigeria over the past several decades is the improvements in birth indices by the training and introduction of traditional birth attendants. Unfortunately, traditional bone setters have not had the same success story, mainly because inclusivity and openness, which will foster improvements in overall care, has not been as widely accepted or widely implemented as it has been with traditional birth attendants. So how do we achieve all of this? First, starts with the person. As mentioned earlier, cultural humility, each person understanding that he is part of a community and part of a whole, and deep and sober reflection, realizing his role, his contributions, and each person understanding their limitations and their frailties and being willing to consider the good of the whole ahead of themselves. Communication is mandatory, and interpersonal relationships to foster trust is necessary with appropriate mediation. We will need to understand that people who have been traumatized in the past are still living with the effects of the trauma, both in their body and their mind, and mediators to foster and to rebuild and help regain trust may be necessary. And all of this will start from an atmosphere of sincere, open, and honest communication. And one of the aspects of this that I believe we need to understand is that for communication to be open and sincere, it will not always be pleasant. People will need to express their fears, express their grievances, express their hurts. And with appropriate mediation and willingness to open up and give trust a chance, relationships can be rebuilt, trust can be regained, and healing can take place, and the impact and severity of the trauma going forward can be lessened. Institutional frameworks are important, as hospitals need to be linked with community healers and the rest of the community so that people who have some form of trauma, be it physical trauma or emotional trauma, or can easily access help. And this will also help to identify things that have been previously viewed as wholly spiritual. Some communities and some people still do not believe the concept of postpartum depression. And mothers who are struggling with the newborn babies often now have the added burden of coping with postpartum depression, a new baby, lifestyle changes, and they don't get the support they need because the people around them are simply not aware of what they're going through. So it will be important that the community healers and community leaders, spiritual leaders, thought leaders in the society be informed, and this information filters down to the general populace so that those who need help can be supported and guided so that they can receive the appropriate help early. Policy needs to be put in place with training, frameworks, and adequate funding, which is well supervised so that the funding goes to the right places and gets things done, needs to be put in place so that at all levels, people are aware of what the needs are and as earlier mentioned, the basic things that need to be done, CPR, basic life support, to tide people who have trauma, physical trauma, over until they're able to access medical help, should be put in place. In addition to this, people need to be aware that trauma isn't only physical. Emotional and psychological trauma is as real and often more lasting and more damaging than physical trauma alone. A case that, to illustrate, very often we find patients who refuse surgery until they get the family blessing. It may be a young woman who needs surgery to deliver a child. It may be somebody who needs a life-saving amputation for diabetic foot gangrene. But for a lot of people, the decision to consent to surgery needs to involve the family. Many times the perception of the healthcare giver is that the patient is an adult who should be able to speak for themselves. But the finances to fund the surgery, the social support the patient will need following surgery will come from the family that the patient is waiting to get their blessing before giving the consent. So in this instance, it's important to engage the beliefs of the patients, to involve the family in the decisions leading up to the care, and to align the care of the patient not only with the immediate medical needs, but with the needs and the expectations of the patient going forward. And of course, the outcome will be that the collaboration with the patient and the family and society will be improved, and we will get much higher rates of compliance. So it's important to know that care often is defined by the patient, as the aim of care is not just to cure the disease or to treat the condition, but it is essentially to restore the patient to the pre-morbid level of function, whether it be mental or psychological function or physical function. So we need to tailor the care to the patient. We need to ensure that the patient has a space where they feel respected and empowered. They need to feel safe.
Concept.
Hello?
You can go ahead, sir. Sorry. That was just a mistake. You can go ahead.
Oh, okay. Can I go on?
Yeah, go ahead.
So patients need spaces where they feel respected, where their autonomy and individuality is respected and protected, and where they feel empowered to be able to make their choices and their decisions based on their care. The caregiver needs to shift from, do I know enough about you, in which we just keep plying the patient with questions so that we elicit a history that helps to arrive at a diagnosis, to what does safety mean to the patient? It may mean to the patient that he's able to make decisions for himself and determine what is best for him. And regardless of what the outcome is, the patient feels safe when they know that their autonomy and their choices have been respected. So, in closing, Africa has several pathways to wellness that lead through, not always necessarily in a straight line, through the community, through faith, through social interactions. And these has to be respected while we are catering for the needs and the conditions that affect patients, because as we've said, the patient is part of a whole and the patient cannot be isolated from the community. Trauma care must be technically excellent while rooted deeply within the cultural context of the patient. And to heal a person, we must heal their world. Thank you very much.
Thank you very much, sir. That was very insightful. Thank you so much. Can you still hear us? Can you hear us? Okay, I think it's just technical difficulties, but if you can hear us, we Thank you. We appreciate you for taking our time to be here on such short notice because, of course, you're here representing the CMD and we appreciate you for your time. We appreciate you for your presence and we appreciate you for that wonderful presentation. Thank you so much, sir. Okay. Okay. If you are still here, please type yes, yes in the chat. If you're there, just say yes, yes, I'm here, and we move on. Okay, so we will now move into the paper presentation session, and to start us off with the topic cultural competence in trauma care within the African context is Dr. Onyemedi Agozo Edotoga, a distinguished scholar, clinician, and advocate whose life work has been devoted to healing hearts, strengthening minds, and shaping the future of mental health practice in Ghana and beyond. Dr. Yemedi Agozo Edotoga is a licensed counseling psychologist and currently serves as the head of the Department of Counseling Psychology at the University of Education, Winneba. With over 19 years of academic and clinical experience, Dr. Yemedi has mentored countless postgraduate students and led groundbreaking research in trauma, resilience, and recovery. Notably, she holds the distinction of being the first woman to earn a PhD in guidance and counseling from a Ghanaian university, a milestone that continues to inspire women and professionals in the field. Our expertise spans trauma and abuse counseling, crisis response, and psychosocial recovery for vulnerable population, including children with special needs and survivors of adverse childhood experiences. Beyond academia, she actively serves a nation, consulting on curriculum reforms, supporting tertiary accreditation, and offering post-trauma interventions through the Ghana Psychological Association during national emergencies such as Buduburam fire and the Apam drowning disasters. Through her leadership, Dr. Agozo Edotoga bridges research, policy, and community service, advocating for trauma-informed education and culturally grounded mental health systems. Her work is a powerful reminder that recovery and resilience are possible when compassion meets knowledge. Please join me in warmly welcoming Dr. Yemedi Agozo Edotoga. Dr. Knight, are you there?
Yes, I am here.
Okay, but we can't see you. We can
Yes,
hear you though.
so let me see what my camera, let me just unmute my camera.
Okay, now we can see you.
Yes, please. Thank you so much for that wonderful introduction. And I want to say a big thank you to JAS Institute and our community of trauma-informed coaches. It is a pleasure to be once again invited to feature on our collective journey towards promoting trauma-informed care on the continent and beyond. My special thanks also goes to our evergreen, ever active and promoting of trauma, Professor Merino, who has been the torchbearer of trauma and healing on the African continent. Prof, thank you so much for this wonderful thing. Our topic is cultural competence in trauma care within African context, lessons from Ghana, Nigeria, and Togo. And this presentation is for myself and one Mr. Kingsley Aram Kinkwaji, who is my PhD student. He is not available now to be part of this presentation, so I will do it on our behalf. Yes, please.
You may want to come closer to your camera because you're disappearing into your background and we can't see your lovely face.
Okay, let me adjust it so that, is it better?
Yes.
Let me still adjust in case. I don't know if it's getting better.
It's much better. It's much better. You can go on, Ma.
Okay, all right. Thank you. So what is the focus of this presentation? We want to look at trauma care in African context, looking at the cultural, spiritual, and communal realities. And we want to look at why cultural competence matters. How do we conceptualize cultural competence in the context of trauma work? Then we'll look at some two case studies. Then we'll look at the lessons from integrating these case studies across the continent, and then also look at implications, research direction, ethical consideration, and policy recommendations. Now, trauma care in the African context, we understand that African context must engage in cultural, spiritual, and communal dimensions that define the African life, the communal life of the African. Across Ghana, Nigeria, Togo, and beyond, trauma is rarely understood as an individual pathology. It is a communal disruption that calls for collective healing, among others. Just a minute, please. I'll have to. My apologies. I'm in I'm in a hotel, and then some others are making noise. Thank you for your patience. Yeah, so we are saying that across Ghana, Africa, Togo, Nigeria, beyond, trauma is not understood as an individual pathology, but rather it is a communal disruption that calls for what? Collective healing. For example, when flood devastates communities in Ghana, people mourn together through drumming, through pouring libation and storytelling. These are not mere customs. These are communal therapies that restore solidarity and meaning to the people. In Nigeria also, survivors of violence often tend to faith-based deliverance and prayer sessions, seeking cleansing and reconnection with their spiritual worlds. If we move to Togo, we can also look at rituals of confession, forgiveness, and libation, which serve as reconciliation tools. And these reflect the deep belief that trauma disturbs both the social and the spiritual order of the individual, as well as the communities the people find themselves. Now, let's look at what Mbiti observed about the African and religion. Mbiti observed that Africans are notoriously religious, and this observation still holds. This observation still holds true today. Faith, spirituality, and community are inseparable from healing. Trauma interventions that ignore these realities, we can say that they risk alienating clients and also perpetuating suffering among the people. Trauma interventions that do not consider these realities would definitely alienate the very client that they seek to help and perpetuate suffering among the people. But when we put these together, when we integrate cultural and spiritual wisdom, then we will nurture trust, we will nurture belongingness, and sustain the recovery process of individuals. We then ask, why is cultural competence an issue? Is it necessary? Does it matter? Cultural competence is not simply about knowing customs. It's not only about knowing the norms. It's not only being accustomed to the traditions of the people, but it's about cultivating humility. It's about respect, and it's about sensitivity to the client's worldview, what the client holds dear to them. This is what we talk about as cultural competence. In Africa, trauma is filtered through unique cultural meanings. Many people have different meanings and unique meanings to their sufferings, to their adversities. Expressions such as thinking too much or being attacked by the spirits, these all reveal symbolic interpretations or symbolic understandings of distress to the individual and to the collective in the communities. If we look at Kinkwaji et al. 2025, they describe cultural competence as the ability to offer care that is respectful of and responsive to clients' experiences. Yet, many trauma systems in Africa still rely on Western models that miss these communal and spiritual dynamics, which are relevant to the total recovery of the client. These gaps need to be filled with research and with conferences of this nature where like-minded people come together to dialogue, to debate, and to find or to chart new paths for trauma work on the continent. A culturally competent practitioner, therefore, needs 4 key elements to work with beyond other Western standards. So these key elements are knowledge, skills, attitudes, and systemic support, as we can find in Kinkwaji et al. The knowledge involves understanding the histories of the people, the belief systems of the people, and their local idioms that they use to express distress. Skills look at the communicating styles across cultures, where we integrate our indigenous forms of narrating stories. Very recently, there was a discussion held by the jazz community where we look at storytelling as an art of expressing trauma or traumatic narratives. So storytelling is at the heart of African communication, and it is important that we integrate this as one key technique in our trauma-informed work. We also need to use collaboration with traditional and faith healers so that we can work together. We cannot do our work because we are steeped in these practices, so we need to work from within. Then we also need to look at another key element, which is attitude. Our attitude as practitioners should revolve around humility, should revolve around empathy and partnership with clients. We need to go down to meet these clients at their indigenous environment, at their naturalistic environment, so that we can work with them from empathetic and respectful perspective. Then the last key, which is very important, is the system support that individuals get. This Kinkwaji Eko referred to as institutionalizing cultural competence through training, supervision, and policy frameworks. Training, our programs, our counseling and psychology programs should be geared towards Africanizing the theories, the system, the techniques, especially falling on the indigenous systems that we have to use. So our training programs, counselor education programs should also be affected in a way so that the training will begin and then help the upcoming practitioners that we have. So cultural competence ensures that trauma healing is not imposed, but it is co-created with those who live the realities of trauma. I want us to look at 3 case studies, one from each of the 3 countries we are looking at. From Ghana, we will look at flooding. I want us to look at a case of the flooding that occurred in 2023, where the dam was spilled. Okay, part of Volta region and other parts of the country were affected, Eastern region, part of Eastern region, but the majority of the part that was affected was the Volta region. The flood happened, and then practitioners from all over, especially from the University of Education, Winneba, went to the field to work with chiefs, queen mothers, to blend traditional mourning rituals with counseling practices. Drumming, libation, and storytelling were allowed and employed to be used, and these were used to create communal spaces for grief. These are the tools that the communities already have, techniques that they already use in case of adversity. So they were allowed to employ them so that these create communal spaces for them to grieve before we started the structured group sessions for them. In this case, ritual that preceded psychotherapy were used to validate the collective pain of the individual, of the communities, and also to reinforce cohesion. When we move to Nigeria, we look at the case of survivors of Boko Haram attacks, especially in the northern part of the country. Survivors of the insurgent, they suffered and grappled with spiritual fears and stigma. Trauma, in this case, built them together, where they collaborated with imams, pastors, and community elders. So the practitioners in this case work by framing counseling as restoring the soul's peace. Sessions combined prayer, just like in the Ghanaian context. Sessions to work with these survivors combine prayer, singing, and psychoeducation. These demonstrate how faith partnership reduce stigma, and it enhances it enhances trust in the trauma care. So it is important that we look at what we have as Africans, the good we have in our traditions, in our culture, and we fall on them. In Togo, we can use a case of domestic violence and gendered shame, where a woman supported through partnership between a voodoo priest, this is a traditional healer, a voodoo priest, and women's cooperative would undergo both spiritual cleansing and empowerment counseling. This integration would restore her dignity while at the same time addressing her safety and agency, giving her power so that she takes control of her life. This integration would help the client not only to feel safe and feel empowered, but also illustrate how spiritual frameworks can be our allies in our journey or in our practice. The spiritual frameworks that we have, we should not see them as obstacles, but we should look at them as allies that will bring us support in the healing process. Now, looking at these three countries with each case study, we want to look at what are the lessons that we can draw as practitioners in the trauma arena. What are the lessons that we can draw from these cases? So we can see that there is a symmetry that cuts across the three case studies. One, community engagement. It means that community engagement is important in our work because it helps us to build legitimacy and encourage active participation. We need the people. We need the community to be actively involved. And when we look at the cases, this is one key example that we need to draw on. Another important thing is to look at the spiritual integration, which helps us to address the fears of the people, and then also talk about the meanings that can shape trauma and trauma recovery. The people need to understand what trauma is. Yes, we understand that Africans have everything to, as community people, as collective people, to work on trauma recovery. But I also want to understand that African tradition in itself is traumatic. We will look at that during another space, maybe tomorrow, our conversation. African tradition itself is traumatic, but thank God we also have what it takes to overcome trauma. So yes, it is important that we look at spiritual integration, but also we need to look at the spiritual ritual as a therapeutic entry point when we are engaging communities in trauma work, because rituals bridge culture and psychotherapy. Rituals, as we have seen in drumming, in pouring libation, in singing, and in dancing, all of these serve as therapeutic entry point for us. So respecting the people's spiritual faith and respecting their rituals or cultural practices will help us get access to them so that we'll be able to support them. Then the next lesson we need to learn is the contextual adaptation of our traumatic techniques. Now, when we adapt contextually, appropriately, this will ensure that our interventions fit the local gender norms, fit the language of the people, and fit into their history so that they can integrate the traumatic experience into their own lived experiences. And it becomes less burdensome, and then they can continue to live so that they do not continue to repress or continue to look back on their adversities, but integrate them into their histories as part of moving on. So together, we can see that these key show that African trauma or African trauma healing succeeds when only we as caregivers, we as trauma coaches, we are rooted in the cultural authenticity of the people. What are the training implications of our presentation? I want to say that training, like I said earlier on, training must extend beyond just clinical techniques to include cultural humility and contextualizing the understanding of the trauma according to the people who lived the experiences. So practitioners like us, from counselors to all helping professionals, should study local trauma histories of the people, should understand community leadership and indigenous systems of the people. It is very key. Having these show your cultural competence of your clients and will go a long way to support your practice. We also feel that universities, they need to integrate models on cultural competence that encourage field placements like we do in practicum already. We should encourage cultural competence where our learners, our students, will get placement in local communities and foster interdisciplinary learning between psychologists, faith leaders, and traditional leaders. In fact, in our case here, our practicum students are free to do their practicum in any of the formal or informal mental health facilities, be they faith-based or traditional traditional-based settings. They are free to do their practicums. The essence is that we want them to integrate into the communities and learn what they are doing so that we can also look at our training programs and incorporate some of these, respecting the cultural competence of the people. For research, yes. Can you hear me, please?
Yes, we can.
I'm almost running out.
Okay, thank you.
For research direction, we are saying that there is an urgent need for us to document and evaluate all the discussions that we've been holding, especially in the jazz community, so that we can move indigenous trauma practices forward. Local scholars should lead studies that explore how cultural ritual storytelling and spirituality foster resilience among clients. We should prioritize to include developing culturally valid assessment tools ourselves so that we can map community trauma responses, look at examining gendered and youth experiences that will help us build better and robust evidence base for Africa's unique contributions to global trauma discourse. Ethically, we need to use informed consent appropriately with respect both of the individual and of the communal decision-making norms. We need to also address traditional rituals or respect them as well in our ethical consideration so that they feel respected and not screened for harm. Confidentiality is key in our work, which we need to integrate closely, not only confidentiality for individuals, but confidentiality of community of people who are experiencing a trauma or one adversity or the other. So we will also look at policy recommendations to integrate trauma services into primary healthcare across the continent, because trauma is endemic on the continent, as said by our convener. We also need to formalize partnership with traditional and faith-based healers through ethical training and referral networks. It is important. So by conclusion, cultural competent trauma is important. It is not an option. It is necessary for trauma work. It is the foundation of effective healing in Africa. It reflects how Africans experience and overcome their own suffering through community, faith, and shared humanity. The stories from Ghana, Nigeria, and Togo demonstrate that when psychology meets with indigenous wisdom, then healing becomes more holistic, more inclusive, and more enduring. By integrating culture, spirituality, and science, African practitioners can lead a new paradigm of trauma-informed care, one that speaks not just to symptoms, but to the soul of the community itself. Thank you so much.
Thank you so much, Dr. Nayet. That was so beautiful to listen to. Thank you very much, ma'am. Always a joy to have you come speak to us. Can you hear me, ma'am?
Yes, please. Yes, please.
Okay. Thank you so much.
Yes.
Yeah.
Thank you once again.
Next, we have emotional support, a pathway to trauma healing in Africa. And taking us through that is a remarkable leader whose career beautifully bridges the worlds of psychology, leadership, and global human development. Dr. Fola Rogers Saliu is a counseling psychologist, trauma recovery coach, and emotional intelligence expert with more than diplomatic service, education, and healthcare consulting. She currently serves as the CEO of Versa Moment Consulting, where she helps individuals and organizations heal, grow, and thrive. A passionate advocate for mental health access and culturally grounded emotional support, Dr. Fola Rogers Saliu has worked extensively with private enterprises, government institutions, and nonprofits across the world. Her voice and influence continue to shape conversations on trauma recovery and psychological well-being. She's also an accomplished author and thought leader. Our recent co-authored book, We All Need Healing, Imagine Pathways to Healing from Trauma and Mental Health Experiences, reflects a lifelong mission to make healing a shared and accessible journey for individuals and communities alike. Beyond her professional excellence, Dr. Fola Rogers Saliu is the co-founder of Triple Passion Home Initiative, a charitable organization that provides vital support for children with severe disabilities. Fluent in English and Yoruba with conversational French, brings a truly global, compassionate perspective to her work. She's also a devoted wife, mother, and grandmother who embodies the very balance and wholeness she teaches. Please join me in warmly welcoming a trailblazer, healer, and champion for mental health and human dignity, Dr. Fola Rogers Sali. You're welcome, Dr. Fola. Dr. Fola, are you there?
Yes, I'm here. Thank you very much, Esther, for that very stimulating introduction. And I must say that I would like to start with my favorite slogan, which is, trauma is real, but healing is possible. Healing is not an option. All efforts by professionals and community leaders and general public should be geared towards healing, growth, and thriving when it concerns healing and recovery of any kind of from any kind of trauma. Please, can you see my slide? I'm trying to share. Okay. Right. My own topic, emotional support, a pathway to trauma healing in Africa, is very interesting. That the presentation of Dr. Nit and Dr. Oladiran had kind of made a framework background for my own presentation. Emotional support, a pathway to healing in Africa. When someone or people are in difficult times and crisis, emotional support is about providing empathy, validation, care, acceptance, compassion, encouragement, reassurance, trust, and especially active listening, which makes them feel valued and understood. I'm trying to share my, okay. Can you hear me?
Yes, ma. We'll help you with the slides. You can just go ahead, ma.
No,
you can
I'm
just
not,
tell
I'm
us when we
actually,
should move to the next slide.
Okay, but I'm actually sharing it myself, and I believe you're saying it. Now, emotional support is provided through community-centered healing. A healthy society, according to, or going by what the two earlier speakers said, it's obvious that a healthy society must first acknowledge its collective trauma. In the African context, emotional support is communal rather than individualistic, as in the Western approaches. We try to reconnect to our roots for community peace, and sometimes it requires the entire village to be involved because of village sacrifices. Collective identity is a shared sense of belonging, and it is about interests, experiences, and goals. Therefore, emotional support for community healing will bring a sense of security and mental stability. Now, an important aspect of emotional support is the resilience through shared history and storytelling. And Dr. Nate said a lot about all these are cultural values. Now, emotional support provides oral tradition and storytelling through the elders. The role of elders is very significant. Elders are community leaders, traditional healers, chief priests, faith-based leaders in the Christendom, in the Islamic world. We have herbalists. We also have representative of the various deities. It's about shared rituals, which will involve offering, sacrifices, purification, pouring libation for cleansing. If you can see the case study I've put forward, I know that I'm conscious of time, but I like to talk about the healing from the Rwanda genocide of 1994 as something to reiterate that emotional support is very powerful in communal African society. The genocide happened in 1994, and 80,000 people, about 800, not even 80, about 800,000 people lost their lives in a span of 10 days. So after that, this is what has brought about this case study of the Gachacha courts, which is for community reconciliation. The Gachacha court story is very powerful and profound. It's an evidence of communal sense of emotional release and support. It's about community attempt for healing, forgiveness, and reintegration with that amount of people that were killed brutally. The Gachacha court was just an open court set up by the local tribunal and the National Judiciary Department. Its community-based approach to justice. They were not confined to the four walls of the court. Rather, it was an open court. And the significant thing about this was that the perpetrators were brought, many of them were brought even from prisons. And it was a first opportunity for the survivors to confront their perpetrators. People were talking about their experiences, and it was very, very emotional. Psychosocial support network were put in place by Red Cross and other non-governmental organizations. And something that I want to share regarding this is to let us know that when we are talking about trauma, trauma is not just about witnessing something or participating. Even for someone who will just have a slight encounter, like a friend of mine, Funke, who shared her experience during this time of the Gachacha court. She was actually working for the United Nations. And the investigators had documents prepared, and they needed people to actually look through, review the reports. And this, my friend, and some of our colleagues had to sit down to extract the witness statements, what happened, and it was very, very, very traumatic for her, especially when she was seeing that people were witnessing where pregnant women were being harassed, and eventually some of them, they would tear their stomach open to remove the fetus or the baby that was almost born, or how some were hacked to death. This was very, very traumatic for my friend, and she just couldn't cope. She broke down many times with her colleagues, and she had nightmares. She couldn't continue. They had to send a team of counselors and support workers to actually work with them for them to complete the assignment. That tells you how deep traumas can be. My next slide. Now, cultural practices and communal rituals. Emotional support is provided through cultural practice and communal rituals, as has been said earlier on. Communities do integrate spiritual and religious support. This spiritual dimension of emotional support can bring a sense of hope and restoration for those affected by deep trauma. Faith-based community support would have intercessors for prayers and Quranic verses and group activities. Also, we have family bonds and close-knit social networks. Close-knit and extended family bond is very, very profound with my story of the Sierra Leone child soldiers. Sierra Leone child soldiers. Good example of when something traumatic like that happens to the whole and entire community. Imagine that children of the age of 12, 14, 13 were recruited into the army to fight the war, to go into war, to leave their parents, to somebody who was their neighbor now became their enemy, you know. So the emotional support will package this kind of events when after the war, children would come back to the society. The family bond and the close family network would already have broken down. So what is the next thing? How would they be rescued? Definitely, the emotional support brought about reintegration, and there was support for trust, forgiveness. There are programs, psychosocial programs for education, for people to come back into the family system. And because Africa is a country where they say that in Nigeria, there's an adage that says that 2 eyes or 4 eyes, that is that of the father and the mother, of course, will bring a child to the world. But it is the whole family, the whole neighborhood, the entire village that will raise this child. So in that context, when something like that happens, the whole village will have to stand up, and then the role of the social support network will simply be about bringing peace, bringing trust, being reintegrated into the society. Now, this case study of the Sierra Leone one brought about severe trauma, violence, brutal acts, witnessing or participating. So the effect of family being the nucleus of emotional support, and often more than the individual, played when it comes to supporting people emotionally. Emotional support will provide a communal sense of emotional release. Support will make sure that nobody is ostracized, isolated. They will feel heard. There will be a sense of direction. Reintegration will mean social cohesion, integration in solidarity, and coming up with sense of identity and social harmony and unity. In total, there will be sense of belonging. That goes to show the strength of emotional support. Ubuntu philosophy. I'm happy Dr. Ladiran also referred to it. What is Ubuntu? Ubuntu is a Southern African philosophy meaning I am because we are, and we are because I am. Dr. Merino said that one finger cannot lift a stone. The same way in Nigeria, we say one person cannot just say we are here. If we are all together, it will be we. Only one person cannot say we are. That is ẹnìkan kò kí ń jẹ́ àwádé. This Ubuntu philosophy is very powerful. It's a powerful tool for collective recovery. If you look at the picture there, I don't know if you're saying it very well, but it shows some kind of shared humanity and interconnectedness. It encourages individuals to seek emotional support from the community. There is shared pain and mourning. They feel together, probably smell together. They feel they are a part of something larger than themselves, especially in the trauma context. Ubuntu is really, really something to look forward to share across Africa. I have a quote there that says, Ubuntu is the sense of shared humanity and interconnectedness that holds communities together in moments of crisis. Traditional healers and counselors. Of course, this can be more effective for individuals from these cultures compared to the Western approaches that may not be as attuned to the cultural values. It's about being inclusive and culturally adaptive. The environment is meant to be peaceful. Sacrifices or communal activity can happen anywhere. If you look at this picture, you've got people making sacrifices there in the thick bush, and the other one happens in the compound. So the traditional healer plays a vital role in emotional, mental, and spiritual healing. Their methods speak to the soul and spirit, helping individuals reconnect to the ancestral wisdom. Breaking the silence, listening and therapeutic conversation. In both African contexts and the Western approaches, listening is very, very vital. One of the motivational speeches I am used to would say, listening is the beginning of respect. When there is respect, trust will come because the person will feel heard. Listening is the first step in respect for being heard and bringing a sense of trust to be developed. By creating a strong emotional support network, conversations around trauma are integrated into daily life. Trauma survivors will be able to express their feelings and begin healing because the shared experiences are honored through a non-judgmental space. A sense of emotional release would be achieved. Now, this the next one is the role of gender and cultural norms. This is about women's role in healing. Emotionally, women are seen as nurturers. They are seen as backbone for trauma survivors, especially when it comes to addressing gender-specific trauma. Gender-based violence like rape, like abuse, they are always handy. When women share their trauma and pain, they strengthen not only themselves, but also the community's fabric as a whole. Women play an essential role for family and community. They are into caregiving, they're into counseling, they're into maternal warmth, especially critical in post-trauma care, like war, like loss, like disasters, like pandemic, and so on and so forth. Women centers, yes, I'm rounding off now. Women centered support groups or safe spaces can foster healing through solidarity and shared understanding of their particular struggles. This picture from Kenya is about healing traditions, how women in a particular county are transforming communities to end female genital mutilation. Now, integrating modern therapy with traditional support is about blending the two approaches, both the Western and our cultural ones. It's described as holistic approach, which builds the mind and soul and body in the blending. It is a way to explore different pathways to seek therapy. For example, where a client can go and see the psychiatrist or the support worker and be able to discuss how a particular herbal drink is effective for his insomnia. And from that, this person can be signposted to other clinical services if that had been taken care of. And then other medical intervention can come. But the important thing is for recognition of the two working and blending together. This is about my last slide. Now, encouraging emotional vulnerability is about peer group support. Peace is always a common factor. When you start a new conversation around mental health awareness, encouraging vulnerability will mean that it is seen as a strength. That is, vulnerability is seen as a strength and not a weakness. There is community sensitization. They have to overcome shame, insecrecy, and isolation. The collective grief for healing will be taken care of. Now, symbolic healing through art and music is what I would not fail to talk about, because it comes down as alternative therapy. Symbolic healing and art music is very good. I just want to tell a quick experience when I was in England working with some ethnic minority who were HIV positive. We had a training session. It lasted for 6 sessions. The last session is always about art and music. And this last session is very powerful. We encourage them to come prepared. And funny enough, they will all come with different forms of art equipment, from their cowries, drums, and all of that. After having the session, people will display, they will do things. We will now have a kind of reflective session. And people will talk about feelings and what they had gained. And incidentally, many of them will just say, oh, with all of this, I am ready for disclosure. Because one of their main issues was about disclosure. And they will say, oh, I am ready. That means music, the African healing through the dance therapy, through knowing that music can heal, music is the medicine of the mind, had already helped them in a great way. By creating a strong emotional support network, conversations around trauma and emotional pain are integrated into daily lives. On limitation and challenges now, I won't waste your time now. The 2 doctors had already talked about economic constraints, stigma, cultural differences, complexity of trauma in the African context, ethical concerns, where our own African way is not actually scientific based. It's very difficult for the Western world to, understand why someone would be addressed as evil, and that is why the child is jailed. And so what do we do? So it's one of the limitations. Over-reliance as well, as Dr. Neat pointed out, on Western model of healing is not very good. Both approaches, cultural values, would have to be incorporated. Faith and traditional will be respected. Stigma, mental health conversation, narratives must be changed. The secrecy around that must also be looked into. So in conclusion, I just want to say that emotional support is a very significant pathway to trauma healing. Trauma recovery is not only about symptoms relief, it is about reclaiming wholeness, especially in communal setup. Connection to culture is very significant. Many speakers, or 2 of the speakers today, have already reiterated this. So I am in line with them. Thank you very much.
Thank you so much, Dr. Fola. It's always a pleasure to listen to you. Such an amazing presentation. Congratulations again on your book. We'll now take a stand, stretch, and breathe. Take a break for 1 minute. So if you can you take a stand, walk around, have take a bottle of water or anything that you're able to do, and stretch. Just take a stretch. Wherever you're watching from, except in a movie vehicle, you can stand up, raise your hands to its limit, bring them sideways and down. I'm trying to do mine on my seat. All right. Position and breathe in for 5 seconds. Can we do that? Breathe in for 5 seconds. Yes, I can see Esther doing it so well. Now breathe in for 5 seconds. Hold your breath for 6. And breathe out like you're blowing in a balloon for 8 seconds. Now drop your shoulders. That's so good. I'm sure you saw Esther did it perfectly. Well done, Esther. Now, when you're done, type yes, 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 yes in the chat box. I want to see you typing yes. I want to make sure that you're all engaged. You're doing so well in the chat. Say hello to someone that you're seeing for the first time who lives within your vicinity in the chat. All right. Now let's move on. Next, we have building resilience in special needs parenting, an African context. And to take us through that is a passionate advocate, storyteller, change maker, whose voice continues to shape the landscape of disability, inclusion, and mental health awareness in Nigeria. Mrs. Bukola Ayinde is the founder of the Diary of a Special Needs Mom initiative under P413 Foundation. She's a lawyer by training, a storyteller by passion, and a strong advocate for disability inclusion and inclusive education. Bukola holds a Bachelor of Laws degree and a Master's in Managerial Psychology. She began a career as a litigation lawyer before transitioning into training and development consulting. Today, she brings that same depth of understanding to her work as a neuro-linguistic programming NLP practitioner and trauma care coach. Inspired by her personal journey as a mother to a child with special needs, Bukola has become a powerful voice for families raising children with disabilities. Through her advocacy, she has helped shift narratives, raise awareness, and promote acceptance across schools, communities, and institutions. She is also a prolific author, having published 6 books that promote disability awareness, one of which, My Name is Mimi, has been translated into 6 languages. Her stage play, The Gods Are Strange, produced in partnership with Gothi Institute, creatively promotes diversity and inclusion and has been staged in schools and theaters across Nigeria. Bukola's ongoing work focuses on promoting inclusive education through school outreach programs in Lagos and Abuja, already reaching hundreds of students. She has produced 2 documentaries on inclusion education and a moving short film on the mental health of parents raising children with special needs titled Mind Shift. Through her writing, speaking engagements, and mentorship of over 100 mothers of special needs children, Bukola continues to champion empathy, inclusion, and healing. Please join me in warmly welcoming the visionary advocate, storyteller, and a voice of hope for families and communities alike, Mrs. Bukola Ayinde. You're welcome, ma'am.
Thank you so much, the soul surgeon. Can you hear me? Hello, the soul surgeon. Can you hear me?
We can hear you clearly, please.
Awesome, awesome. Okay, can I have my slides, please? I have barely 15 minutes. Okay, before I start, let me say thank you for having me yet again at this Trauma Conference 2025. I'm so excited to be here. And to the convener, I say God bless you, because this is a much needed topic for such a time as this.
Okay, going straight into my topic, building resilience in special needs parenting and African context. As you have heard my profile, I'm very passionate about this because it's my daily living. You know, like she said, I have a child with cerebral palsy, to be precise, and I'm resident in Lagos, Nigeria. I'm going to rush through my slides until I get to the slides that particularly, speak to the topic on building resilience and looking at it from different lenses, but I will focus on the trauma aspect. So next slide, please. Okay, so introduction briefly. Parenting a child with special needs is a journey of love, patience. I mean, if you're someone, if a person does not have patience and you have a child with special needs, it is a, you are in the school of patience that you cannot graduate. It is patience, it is long suffering, it is perseverance, and adaptation. Then in Africa, we have our own special challenges, our unique challenges. But from all the trauma, the emotional stress and this and that, we now have our cultural beliefs and limited resources. So that adds to the already challenges that we already have parenting children with special needs. Now, what is resilience? It is the ability to adapt positively despite adversity. So building resilience helps parents thrive and not just survive. I believe you are handling my slides for me. Okay, so understanding resilience. So it's not just the absence of pain, but the ability to recover and continue with hope, right? And African parents often rely on the faith and spirituality. I'm going to talk about this, later on in future slides. So I'm just going to mention it and move over. We rely on faith and spirituality, family and community, cultural perseverance. However, modern isolation and stigma now weakens these support systems. Okay, so cultural and social influences. Disability is often viewed through superstition or shame. In Africa, we see parents who have children with special needs. Some would say, oh, the mother has committed a sin, or the parents use the child for a ritual purpose. And this kind of prevalent narrative brings shame, and thereby the families will hide the children, they lock them up in the houses, and this will delay medical care, it will delay therapy. So next slide, please. Oh, okay, pardon me. Major challenges faced by the parent. So we have the limited access to healthcare and therapy, inadequate inclusive education. At times, it's not even the inclusive education. You don't even have access to special education, the right one for children with special needs. Then you have the economic strain and loss of income. Oftentimes in Africa, one parent has to stay at home, and that is usually the mother will stay at home to care for the child with special needs. So you have reduced income, and in another aspect, you have marital tension and burnout. Today I have a support group for moms who have children with special needs, and today we have many mothers who have become single mothers due to the marital tension of having children with special needs. We also have the social isolation due to stigma. Oh, I don't want to associate with this family because they have a child with special needs. Oh, I don't want my children in the same classroom with a child that has autism. Oh, that child is drooling. I don't want my child to talk. They are inviting children for parties. Your child is isolated. So there are all these things that are causing trauma for parents of children with special needs. So you have the emotional exhaustion and fatigue. You know, I often tell parents that when your child has a disability and you get the diagnosis, it's not just the child that needs help. The parents needs therapy. They need trauma. They need to see a trauma professional to help them understand what they have just gone through. Because, you know, having a child's diagnosis, it's going to, that means you've gone through trauma. And for some parents that have children with severe disability, they go through trauma every day. They live through trauma every day. Okay, so now to my main discussion is pathway to building resilience. How can we build resilience as parents of children with special needs? How can you, as a trauma professional, help a family who have children with special needs build resilience, be able to thrive, and not just to survive while caring for their children with special needs? Number one is faith and spiritual grounding. Whether we like it or not, in Africa, we are very spiritual people. In fact, when I have a client, you know, I start from their faith, because with most of them, that is where you can connect with them. The moment if you say something, you know, totally different or off, they shut down. But when you come from their place of faith, you know, you're able to connect to the parents, the mother or the father, before you can get to them about trauma treatment. So faith and spiritual grounding. Faith provides strength and meaning. Prayer, scripture, affirmations, meditations, they bring comfort. However, on this particular note, we have to tread with caution. We have seen, and as a believer myself, I will say my people perish for lack of knowledge. This particular point has been twisted by many so-called faith-based institutions, whereby the children have been termed demonic and they have been starved, beaten, changed, you know, just to remove demons from them. You know, at this point of faith and spiritual grounding, we need to let the parent know that God loves them and their child, and they've not committed a sin. You know, it's not about you've done something wrong, so you deserve to be punished, and the way God has decided to punish you is by giving you a child with disability. This is at the core, you know, of shame. This is at the core of depression for many parents who have children with special needs. Mothers have come to me to say that, what have I done to God to deserve this? So this is a point of connection to actually handle, you know, build resilience for parents who have children with special needs, for them to understand that God loves them, God loves their child, God knows their child. You have to start and connect with them based on their faith. Number two is community and peer support. Very, very essential. Support groups offer connection and learning. Parents realize that they are not alone. They're in the community of other parents who are going through the same journey as they are. People who will not, you know, who do not have bias, who will not condemn them, who will not, you know, judge them. They know that these people understand what I'm going through. If I say I did not sleep at night, they understand what it means. If I say I'm buying expensive drugs monthly, they understand what it means. If they say I'm going for my appointment, you know, and they learn so many topics, so many things are being shared in this community and support group. Last week, like I said, I run a support group for moms as well. Last week, we had a picnic for mothers. And we told the mothers, don't bring your children, you know, don't bring your spouses, just come. And we danced, we played games. You could literally see years of, you know, the faces of this mother. And they were really, 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 you know, happy to be in that community.
We have 2 minutes left, ma.
Don't worry, I would. Okay, so
Okay.
the third point is education and advocacy. Knowledge empowers parents. I tell parents a lot about, and the moms especially, that you are your child's first doctor. The doctors, be it the pediatrician, the neurologist, they don't know your child as much as you do. So the mothers, especially the mothers who are the first caregivers, they need to have knowledge, they need to be empowered as parents. Advocacy improves inclusion. They need to speak up, to speak for their children, to speak in the community, to speak in the school, to speak in religious institutions. Number 4 is self-care, which is the basis of my speech today, is self-care, mental health. In Africa, we shy away from trauma therapy. We believe, it's for, I've heard different names. I'm not mad. I'm not mental. I don't need this. And you're talking to a parent and they tell you, all I need is a cure for my child. All I need is therapy for my child. I am okay. Parents will tell you that they are okay, yet they are breaking down. Their health is breaking down. Their finances is at zero. Their marriages are collapsing. There was a time in the support group, we had a few moms who passed on due to ill health. So rest and trauma care is very important in caring, when handling children with special needs. Parents to rest, to go for therapy. Therapy is from a point of wisdom and not weakness. Okay. I'm not able to share my slide myself. Okay, so no, let's go back. I'm not done yet. Don't be so fast. The 5th point is skill development and economic empowerment. The parents, you need to learn a skill, you need to develop a skill, and you need to have money, whether you're working from home or not. Then you need to partner with professionals, partner with teachers, with therapists, to ensure holistic care, not just for your child, but for yourself. Next slide. So if you don't remember anything in all I have said today, is that you need to collaborate with your therapist for your child and for yourself. Next slide, please. Collaborate as a parent of a child with special needs. Collaborate with your therapist, your trauma care therapist, your therapist for the physical therapy for your children, your teachers, all the professionals. You need to collaborate with them, because it's not a journey that you can do alone. You need to collaborate with your family, where you have a supportive family. You need to collaborate with them. In conclusion, resilience is built through faith, trauma care, community, and courage. There's no need to fear. You won't be the first person to have a child with special needs, neither will you be the last person. So what you need to do is to build courage. And there are people, professionals, trauma care professionals, willing to help you walk this journey. It is not just survival. You're not on earth just survival. It is rising each day with purpose. Every child can thrive. Every parent can find strength again. Together, we can build an inclusive Africa, one resilient family at a time. Thank you.
Thank you so much, Ms. Sainde. Always good to hear your voice and beautiful to listen to you. You're doing great. Your strength is amazing. We wish you more strength and passion as you continue this journey of helping other mothers and fathers on their journey of also raising a disabled or child living with disability. Thank you so much, ma'am. We appreciate you. Okay. If you are still here, please feel free to use the chat and say yes. Okay. We're moving on now. And next, speaking on family trauma, is a seasoned development professional and passionate advocate for equity, healing, and human dignity. Olajumoke Olabimpe Dada is a global health, social development, and trauma care specialist with over 2 decades of experience driving transformative change across national and international development spaces. Her career has been dedicated to improving healthcare access and enhancing the quality of life for poor, undeserved, and vulnerable populations across sub-Saharan Africa and beyond. With a heart for people and a mind for systems, she has consistently worked to bridge the gaps between policy and practice, ensuring that healthcare delivery is both equitable and inclusive. A true advocate for social justice, equity, diversity, and inclusion, Olajumoke brings a rare blend of compassion, strategy, and collaboration to every space she occupies. Her strength lies in her ability to connect the dots across systems, sectors, and stakeholders, fostering partnerships that lead to meaningful, lasting impact. She is deeply committed to helping communities heal from trauma, thrive in resilience, and find hope through collective action and support. Please join me in warmly welcoming Olajumoke Olabimpe Dada, a leader, trauma care specialist, and tireless champion for well-being and health equity. You're so welcome, ma'am.
Thank you very much, Esther, and thank you, everyone. Thank you, Professor Merino, and for this opportunity to be able to present in this year's conference. I find it to be very honorable and privileged to do so. Quickly, let's dive into it because my time is really short. In the African context, really, healing is communal, and that is what every speaker have been saying all along. So yeah, trauma is often named and addressed through relationships, especially with ancestors, nature, and community. So the primary purpose of this topic today is because the African culture thrives on this community. Because again, we are communal, right? We are very communal in nature. However, globalization has eroded that communal nature and understanding, resulting into different kinds of disintegration or traumatization. So the African culture needs to be integrated back into medicine, or medicine integrated back into the African culture. Both of them are not independent of each other, just like the keynote speaker said. And knowing fully well that the family is the main unit of the society at large. So we need to thrive as a family, as a community. And we also need to heal together when one or all is affected. Ubuntu, as repeated. So now, understanding family and systemic trauma, is good we have a clear understanding of this. So I'm speaking about the family trauma. We talk about the emotional wounds that is passed through generation, primarily probably psychological, emotional, or relational wounds that occur within the family system. It is often passed down from interactions, behavior, or unprocessed pain. Why on the second, speaking about the family system trauma, it emphasizes that trauma isn't just about the individual, but the entire family unit. I'm sorry, please, I'm still on the former slide. It's about the family unit. Talking about the siblings, the parents, the grandparents, extended family. So trauma affects how family function, communicate, and relate together. So in Africa as a continent, personal trauma often mirrors community and historical trauma. Healing the family system, contributing to healing the nation. Already, previous speakers have spoken about this. So when one person heals, a lineage begins to breathe again. So next slide, please. So what are the forms of family trauma? We have the acute events. This is like a sudden painful disruption. For example, we talk about domestic violence, we talk about sexual or physical abuse, we talk about verbal abuse, we talk about parental separation, divorce, we talk about death of a parent or siblings or child, or even death of both parents. We talk about accidents, disaster, war, displacement, immediate ones. And also looking at another form of family trauma, we're talking about chronic stressor. Like that means the ongoing conditions, that are causing psychological distress. We talk about neglect in all forms, parental or child substance abuse or mental illness. We talk about financial hardship, poverty, interpersonal conflict, sicknesses, parentification. That means children taking the role of parents, And then the last one is the intergenerational and transgenerational trauma. What do we mean about that? We talk about trauma that has been passed from one generation to another generation, that has been passed through generation, pain that has been inherited from historical injustice, slavery, colonization, war, forced migration, genocide, and all of that. You know, we also talk about intergenerational and transgenerational trauma could also mean family rules, belief, coping style that has been shaped by ancestors that had unhealed wounds. So let's go to the next slide, please. Looking at trauma in African family roles and the pain and the possibility. So now we're going to look at this from both ends. We're going to look at the pros and the cons. Looking at the parent-child dynamics, we have, you know, the traditional proverbs and storytelling within the family system. This could nurture resilience, just like the last speaker spoke about resilience, as well as there are some disciplines like harsh disciplines, silence about pain, which can re-traumatize families. What do I mean by this parent-child dynamics? There are different practices within families, you know, that either re-traumatizes or heals. Positive practices like ritual foreclosure. I mean, all speakers made mention of rituals, libations, and all of that. The Ubuntu philosophies in Rwanda, you know, the communal support system. These are positive practices between families, you know, that could cause healing, especially looking at parent-child, the storytelling, the proverbs, the faith-based reassurance, the support systems, and all of that. It could result to healing. Whereas looking at it from another side, there's a practice of silence in the family. You don't speak about trauma. There's the part of harsh discipline. Parents, there are some parents in this time and age that still cut their children with blade and use what's it called, salt or pepper as a form of punishment. That is a form of trauma, especially maybe when they steal or they commit a crime. That is trivial in some instances, right? There's these gender role expectations, and there's these expectations of boys don't cry, only girls are meant to carry out domestic duties and all of that. These are negative practices between parents and children that causes trauma. And for some children too, expectations from parents and also expectations from children and all of that. Now, looking at sibling trauma, please, I'm still on the first slide. I'm still on the previous slide. Hello. Or should I go ahead and share my slide? Okay, thank you. Yeah. No. Sorry, please go back. No. You are going to the end of my slide. The previous one, please. Yes, thank you. Yeah, sibling bonds. There are times that most parents, probably they are busy in this time and generation that we are in. In the course of all that, siblings now become caregivers to their other siblings. In most cases, these are children. In most cases, they are teenagers. You know, in most cases, they are even adults who have their own personal responsibilities. But because the parents are not present, they take up the responsibility of their parent. This could be positive as well as traumatic. Yeah, it could be positive as well as traumatic. And looking at spousal relationship as well, you know, in most cases, there is the issue of domestic violence, which could be traumatizing. And there's the issue of faith and solidarity, which could anchor healing if it is in a positive setting. And also looking at the cultural tradition, everybody has been speaking about rituals, communal meal, Ubuntu, and all of that. So I'm not going to go into all that. So in recognizing both sides allows families to choose practices that aligns with dignity and restoration, not practices that destroys. So the next slide, please. Yeah, so because we are looking at the African context. However, there are some global theories, right, that are relative with the African framework. For example, the African systems theory. The African systems theory is a theory by Murray Bowen, right? It says that family operates as an emotional system where each member affects the other. So when trauma disrupts boundaries, roles, and communication patterns, it doesn't just affect one person, it affects everybody. So that is how the family system theory affects the family role, because family are meant to be to provide emotional system, just like Dr. Roger said earlier on. They are meant to provide emotional systems. Then looking at the other theory that spoke about attachment theory, it highlights how consistent love and care can restore safety in the family setting. For example, when there is trauma in caregiving relationship, right, it could result to insecure attachments. It could result to neglect, especially when it persists into adulthood. However, looking at it that it's also the consistent love and care, can also restore safety, right? And also looking at structural family therapy, it fits well in African extended family context, where hierarchy and respect are central. To be honest, Africa, our value system thrives on respect and honor. We recognize hierarchy, right? So in the structural family therapy system, what that talks about is it looking at the family subsystems, the boundaries and the hierarchy. And most times trauma leads to disengagement and role confusion. But in a situation whereby there is therapy, there is a better flow of hierarchy.
Ma'am?
Yeah.
You have 2 minutes more.
Almost done. And also, they spoke a lot about storytelling. Please, next slide. Next slide, please. Okay, so how does globalization affect, influences African practice? The positive is that globalization has given us access to modern therapies, to breaking silence, cross-cultural learning, digital platform, youth empowerment, and gender empowerment. However, on the other side, it has eroded a lot of traditional practices. It has resulted into a lot of cultural identity crisis. For example, our language is now called vernacular. It has resulted into commercializing our traditions. It has re-traumatized a lot of people and a lot of that. So globalization influence, even though it has brought a lot of clinical care and all of that, and they are available, blending them with our practices can make care to be more acceptable and sustainable. So next slide, please. Yeah, so these are the different ways of healing. The previous speakers have spoken on every one of them. I'm not going to say so much about them. I'm only going to emphasize on the trauma-informed care practices. And in speaking about informed care practice, just talking about the fact that as family, we create a safe environment for people, every member of the family, to feel seen, to feel heard, to feel valued, to be loved, and there is no judgment, right? We don't judge one another, especially when we do something wrong. And also to recognize triggers, everybody's triggers, and avoid practices that triggers others, and also avoid practices that re-traumatizes one another. Then also promote trust, choice, empathy, time, and collaborative healing. And lastly, in bringing clinical care into cultural resilience, talking about the TFCBT, that's the trauma-focused cognitive behavioral therapy. It just means that our local languages, our proverbs, our cultural metaphors are used to provide this clinical care. Yeah, in the case of EMDR, drumming and rhythmic movement can be used to practice EMDR. And also for the somatic experiences, body awareness, breath work, or movement-based healing can just be used to practice somatic experience. It just means that the clinical practice are being done, but in a more cultural way that can be more adaptive and more integrated and more embodied and more sustainable. So in a nutshell, let me just say that trauma affects generation as well as healing. Silence break when stories are being told. Cultural wisdom is medicinal in the context of our African culture. Healing is relational, not individuals. One of the speakers talked about there are different healing, there are different methods of healing. However, look at the one that is most suitable for you. And also, every healed family strengthens the soul of a nation. And finally, my final reflection on this. The last slide. Healing is not the absence of pain, but the rediscovery of wholeness. When African families embrace trauma-informed care, they not only heal themselves, they awaken the continent's ancient gift of collective resilience. Thank you very much, and enjoy the rest of today.
Thank you so much. Thank you so much, Olajumoke Tata. Always a pleasure to listen to you. Can't forget our family trauma conversation. Thank you so much. Thank you for wishing us a blessed day. And thank you to everyone who's been listening. Okay. The moment that we have all been waiting for, we have testimonies from our alumni of the Jazz Traumatic Stress Training Institute as they share their journey and their success stories of trauma care in their context. First, we have a gentle yet powerful voice in the field of emotional healing and faith-based recovery. Mrs. Chichi Osagede is a certified trauma care coach and mentor, trained through the Integrated Trauma Care Coaching Program and equipped in Kadasile Healing Model, a holistic approach that supports emotional and spiritual restoration. Her passion lies in walking alongside others on their journey towards healing, faith, and purposeful living. Through her compassionate guidance, she helps individuals rediscover hope, rebuild inner strength, and reconnect with meaning after life's painful experiences. Chichi's work beautifully reflects her belief that healing is not a destination, but a journey of grace, courage, and community. She is happily married and makes her home in Kenya with her family, where she continues to inspire and nurture those seeking wholeness. Please join me in welcoming a dedicated trauma care coach, mentor, and beacon of hope for those on the path to healing, Mrs. Chichi Osagede. You're welcome, ma'am.
Thank you very much, Esther. Thank you to every organizer for inviting me to share my experience in the Integrated Trauma Care course for professionals. I'm so delighted to be here. I am thankful that I had that opportunity to be a part of the course this year. I was in the February cohort for the Integrated Trauma Care course for professionals, and I got introduced by Esther herself, who just introduced me a few minutes ago. So yes, that's how I got to hear about the course, and I applied it immediately. She told me about it because I had worked with young people for more than 10 years. And as I worked with people, young students on campus in the university, I discovered that some of the issues that they were sharing with me were issues that some of which I didn't have the necessary skills to be able to manage because these were trauma-related issues. I struggled. And so when I got into conversation about what trauma is and how trauma can be dealt with, the Integrated Trauma Care course sounded like something that I should be a part of. And I'm so thankful that I was a part of that, this cohort. It was an amazing time. It was an amazing experience with my classmates where we would meet once a week, and we had 8 weeks of class where we were giving intense information. It was a great time, so much exposure. It was great because for me, the word trauma felt like an inappropriate word. I had been exposed to that word being used in ways I felt people were either exaggerating it or using it in ways that I didn't really understand how they understood the word trauma. But as I went through the trauma class, not only was I exposed to so much information, I learned what trauma really is. I learned techniques that help manage a client's symptoms. Someone who has gone through trauma, I understood what it meant to manage their symptoms. I also was taught how to ask good questions from my clients to be able to help them to uncover those traumas that they have been through. Not only was I taught how to answer good questions, I had 12 weeks to be able to select someone and would journey with this individual. It was a 12-week of practicum where I was supervised every week, not just me, but all of my classmates. It was amazing. It was like I was not journeying alone. We had Professor Merino work with us, each one, and she gave us intense feedback. The feedback was amazing. And then you knew what to do the next week when you met with your client. It was a 20-week experience, and it was worth every moment of my time. I'm so thankful that I understand what trauma is and that trauma can be treated. It is a journey that I would hope everyone has exposure to. I learned a lot of patience with my client, even as I worked with her. I currently live in Kenya, and in the sphere of where I live, there are people who have also experienced trauma. I am currently working on building a trauma coaching platform where I can help meet the needs of trauma that surrounds me, so that I can be a blessing to everyone that I meet who has experienced trauma and help them to get healing for what they have experienced. Without much ado, I would say thank you so much for this privilege to be able to share my experience with the Integrated Trauma Care course for professionals.
Thank you, Mrs. Chichi. Thank you so much.
Thank you, Esther.
Yeah. Okay. Next, we have a compassionate leader, pastor, community builder whose life, whose life's work reflects both faith and service to humanity. Reverend Agbonu Richard serves as a pastor of the Assemblies of God Church in Pando Toko, Ghana, where he provides spiritual leadership, pastoral care, and guidance to his congregation and community. Beyond the pulpit, he is deeply committed to social impact. He is the director of the Rural Needy Child Organization, an NGO dedicated to supporting vulnerable children in rural communities, and a master trainer with Training to Send Ghana, where he helps equip others for community transformation and service. Reverend Richard's academic journey reflects his passion for both theology and mental health. He is a graduate of Akasi College of Education, the Assemblies of God Theological Seminary, and the West Advanced School of Theology. He is currently studying at the University of Education, Winneba, and is completing the Integrated Trauma Care Coaching Program at the JARS Institute. A devoted husband and father of four, Reverend Richard continues to integrate faith, psychology, and trauma care to promote healing, hope, and holistic well-being. Please join me in warmly welcoming a shepherd, mentor, and advocate for healing and transformation, Reverend Agbonu Richard. You're welcome, sir.
Thank you so much. Good afternoon, everyone. I stand on the existing protocols. It is a great joy and a delight to be here doing this. Thank you, Prof. Merino, for the great opportunity given unto me. I am here to give you a snapshot of my journey with the Integrated Trauma Care Program. I learned a book advertisement. Although knowing about the existence of trauma, I was clueless about the effective ways to address it or deal with it. That is why the guidance and learning provided on coaching and supporting individuals affected by trauma was not only enlightened but transformational for me. I realized that trauma significantly impacts human efficiency and productivity. Many Africans like myself, before encountering JARS Educational and their works, are completely unaware of trauma and trauma care. They are not aware that trauma care is accessible and is very affordable. While traditional and cultural practices often seemingly overlook trauma, allowing it to affect children and adults profoundly. Educating people about trauma care and identifying cultural intersections with trauma-informed principles can mitigate its effect on individuals. As a Ghanaian, as a proud Ghanaian, I plan to establish an agency in partnership with the Institute to train others in coaching and caring for trauma survivors. By empowering local communities, we can create a ripple effect, benefiting more individuals and ultimately benefit my nation, Ghana, and the rest of Africa. It's essential to approach trauma care education with passion and dedication to support those struggling with its effect. I can truly say my journey with integrated trauma care has been life enriching. I would like to extend a heartfelt thank you to Professor Merino for her transformative guidance. The wisdom she shared had a profound impact on me, and I am committed to paying it forward. Thank you, and God bless us all.
Thank you, Mr. Richard. Thank you, Reverend Richard. Sorry, my apologies. Thank you so much for your testimony. And I'm sure Dr. Merino can hear you, and she's as well receiving your appreciation. Okay, so we will now listen to our host and CEO as she presents the unveiling of the dynamic, much anticipated book, Trauma Recovery and African Global Perspective, and the Kadasile Trauma Healing Training Workbook. But before she comes up, I would like to tell you about our Professor Merino. Professor Akindotu Merino is a dedicated professor of psychology and a passionate advocate for modernizing mental health structures and reducing disparities. Her extensive career spans academic leadership roles, including being university president in Southern California. She has also contributed significantly to community agencies and hospitals. Currently, she serves as a mental health commissioner, overseeing services for 500,000 residents in the 4th District of Southern California. Professor Merino is the convener of the symposium and the driving force behind the Africa Trauma Care Alliance, ATCA, both dedicated to trauma care integration, mental health advocacy, and research in Africa. Additionally, she is the CEO of JARS Group and the president of JARS Education Institute, where she provides trauma-based training to professionals, life coaches, and mental health providers. Dr. Merino's contributions as an author, an international keynote speaker, and her recent recognition in the 2021 Woman of Distinction by the California Assembly Legislature highlights her impactful career. She resides in California with her family. Please welcome with me, Professor Akindotu Merino.
Hello, everyone. Oh my goodness, it's been amazing. Thank you for all this to all the speakers who have gone ahead of me. I have just been here, just taking notes and enjoying every single one of you, bringing in your own perspectives and your own research. Today, it's a day that I have been looking forward. I've been looking forward to, because we are ready to talk to you about the textbook that I have been working on. And I think I have a PowerPoint somewhere, so somebody can put that up for me. I will be great. I would be grateful. Is there a PowerPoint somewhere? Well, while they're putting up the PowerPoint, it should have my name on it. So just put it on. If you can find it. No, the PowerPoint. Yeah, so help me, if you can help me find the PowerPoint. It should just have my name on it, and it should say, nope, that's the image, a PowerPoint. Let me find the PowerPoint myself at this point. All right, everyone, thank you so much. That is the PowerPoint. And so I wrote a white paper on this, which I'm going to be presenting briefly from, so you can follow me with the PowerPoint. Welcome to this section. Basically, this textbook is re-examining trauma and recovery through an African cultural lens. So the title of the textbook is Trauma and Recovery: An African Cultural Perspective. All right, and it's released in 2025. So if you're here today, there's going to be a link that you can click, and you will receive a copy of the textbook. So please make sure that you wait till the end so you can get this link. When Africa approaches trauma, we often look at it from a very collective healing lens, like all of the other speakers I've talked about. This book, however, argues that the individual is just as important as the collective, that the individual must not disappear with the collective. It's the whole idea of differentiation, which means that there is an I and there is a we, an I and a we, then that those two have to be balanced somehow. So the true healing in the African context requires a dual framework. It needs a dual framework. We need to re-examine the whole community-only framework. We need a dual framework, one that honors the power of community-based recovery while protecting and restoring individual autonomy, individual voices, and the individual's identity. Because we find that sometimes we get lost in the collective. We overemphasize the communal harmony sometimes, and unintentionally, we silence the personal pain. Nobody's going to talk because we don't want to destabilize the collective. We reinforce stigmas and we delay individual recovery. So this textbook is giving permission to not just for the collective healing, but for the individual healing. We must do both. By integrating indigenous, wisdom with the trauma-focused psychological care, Africa can advance to a bi-directional model of healing. So this textbook is a bi-directional model of healing, one that heals the self through the community and the community through the self. So it heals the self through the community and the community through the self. If you're with me, let me hear your voice in the chat. So that is the introduction. Let's just do a little bit of introduction to the cultural imperative and the individual within. So trauma in Africa is both collective and personal. The continent continues to bear the psychological weight of everything we've heard today: colonization, kidnappings, conflict, gender-based violence, displacements, etc., etc. We can list all the pains and we can keep listing them. The African healing frameworks have prioritized the collective, like you've heard so many of our speakers talk today, and those are pertinent and they are relevant, and we should do those. Right. However, when collective recovery eclipses individual healing, victims of trauma or survivors of trauma may feel unseen or pressured to conform to societal expectations of strength and silence. So you hear things like, you're not the first one to experience that. You're not, your mother experienced it, your father experienced it. This is the way it is. You're in your husband's house. You're supposed to suffer. You're this. You're supposed to do this. So so those individual voices are then silenced. Healing, therefore, must include personal psychological empowerment alongside the communal belonging. So this textbook uncovers that there is no health without mental health, but it extends that principle that there is no collective health without individual well-being, that the individual also matters. Number two, I will redefine trauma beyond the collective paradigm. While many African societies, interpret trauma through spiritual or social imbalance, this perspective can risk over generalizing personal sufferings as communal disturbances. So the proverb, "I am because we are," that most people have talked about today, it captures the interconnectedness or connected nature of our African identity, but it also demands that we rethink that proverb. We are because I am. Let's add that to it today. So it's not just I am because we are, but today in this textbook, it begins to reshape our thinking that we are because I am. We are because I am. So it is important. Those two can walk side by side. So some of the key insight of this textbook is that you're given permission to heal the collective as content, not the container. The collective is the context and not the container. It's the context and not the container. Community is essential, but it is not absorbed or silence, or nor must it silence the individual experience. Healing must allow for personal narratives and boundaries. So it's not just about our story, it is about my story, because I am Africa. So we need to begin to speak in that way. We need to begin to heal in that way. The individual as healer, each person's self-understanding, self-regulation, and self-care contributes to collective resilience. So when I am strong and you are strong and you are strong, then the collective is resilient. We need balance over biases. When trauma recovery programs prioritize only communal harmony, which we must do, by the way, I'm not saying we shouldn't, we must do that. However, when that is our only focus, then individuals may repress their pain to preserve social cohesion, which delays emotional release and cognitive integration. So we have to be containers of that. Number 3, psychoeducation and dual healing competence. Psychoeducation, I believe that education is healing. Psychoeducation contains and remains a cornerstone of effective trauma recovery, and even in the African context. However, education programs must go beyond group sensitization. They should equip each person, individuals, to also recognize, name, and process their own traumas privately as well as communally. So get help, talk to a counselor, talk to somebody who has been trained to do this work. Balancing strategies. Well, we have communal literacy, and we have personal agency. We have safe private spaces. We have communal spaces. We have digital and hybrid learning, using your mobile platforms to reach individuals who may fear social exposure or stigma. Examples of integrated success. We have integrated successes across the continent. The Friendship Bench in Zimbabwe, for example, it demonstrates community-led counseling with space for individualized problem solving. So they're still working as a group, but at the same time, there's space for individualized problem solving. We have school-based programs across Nigeria, in Malawi, which allows peer support with one-on-one mentoring for vulnerable youth. We have diaspora teletherapy therapy models, which are emerging online, which connecting African diaspora clients with culturally attuned therapists worldwide. We do that at JARS. We have trained over 200 trauma-focused coaches across the continent, and we're still doing the work. And we connect, clients to those who need help. And so this is something that is been done. So we have to walk and chew gum at the same time. Number 4, rethinking traditional healing and making sure that we are understanding that that Africa has been healing herself for generations. So understanding that we have those transformative rituals that can be that we can tap into. Some people have talked about drumming. I mean, I was at a conference here in the United States in Northern California a few months ago, and what would you know? It was a psychology, mental health conference, and they brought South African drummers to actually do perform some healing rituals there. So this is something that we take for granted here, but we have it. We have our own herbal medicines. We have our own storytelling. There's been a lot about storytelling. Tell your story. Let your story carry you. We have collective experiences by design. Yet within all of this, the individual journey must also be centered. So we have communal rituals that can complement with personal reflection. So we need to start thinking about things about, maybe journaling, maybe therapy. It's okay for you to not be okay. It's okay for you to go get help. In that textbook, I opened up with the story of my own personal life, just so you know that if you grow up in Lagos, if you grew up on the continent, that you have also experienced your own types of trauma. These traumas that we don't talk about. My mother died when I was 12 years old, and nobody talked about it. It was just like she died, and then 12, bam, she was dead, and then nobody talked. In fact, it was even worse because they told my sisters that she went abroad. Can imagine that. And then she just became somebody we didn't talk about. And so you can imagine the trauma of that. And so there's so many traumas, and that's not just happening because you're on the continent. It happens to anybody, to anyone. But we've all been touched by it in one way or the other. And so the permission is we have to heal our individual pains, so that we can also heal our collective pains. So the proposed framework is we have cultural integration, we have empowered agency, we have relational autonomy, and we have our strength in implementation. The African diaspora also shows up in this textbook. So it's not just for those in the continent. Every African who is in diaspora, there are two, I think a chapter or two that is just for you. Negotiating between self and society. It's in the textbook, so make sure that you lay your hands on it. This paper, this textbook proposes that diaspora mental health care must embrace hybrid practices, community-based support groups, and reinforce belongings alongside individual therapy. So this is the book that has been written, and this book also emphasizes that we are showing trauma healing from an African lens, and an African lens includes the collective and the individual. The book also focuses on policies and practice recommendation in the book. But finally, we talked about a proposed model happened in that book. The proposed model that happened in that book is the Kadasile trauma healing model. The Kadasile trauma healing model. And this is what we've been using at JARS Institute to actually train our practitioners. So it is literally about 5 months to go through the training. So we only have 2 cohorts per year. We have 2 cohorts per year, and those are the cohorts that come in February, and then another one comes in August, I believe. And so these are the Kadasile model came out from after writing this textbook. It came from writing this textbook, and that we needed to do something different. And so that's the Kadasile model. The Kadasile model has a stage, very linear stage process. So it means that a step process. We started with pre-stage. We talked about the 5 fundamentals. So we talk about 5 fundamentals, and in the 5 fundamentals, then we go to stage 1, stage 2, 3, 4, and 5. And in all of these stages, every single healing tool is African. Every single healing tool has been merged with what we have in the West and what we do in Africa. There's so much that can be understood from that. There is the book, and I have something I want to show you, which that's the book. That's the textbook right there. That's the textbook you're seeing on the screen. And also, can you pull up Coach K's Kadasile jingle that she did? It's up there. I put it up there somewhere.
That's Yoruba. In English, it is throw it all down and out, then pick up only what. So I want to talk about the Kadasile Katunsha concept. In English, that's Yoruba. In English, it is throw it all down and out, then pick up only what serves you. I have notes, so I'm looking down at my notes. Throw it all down and out. Let it all go. Care nothing for what you have thrown down. Rather, care for you and your thought and your heart life. Be determined to be whole, because as a human being, that's your right. Listen, not only can you help yourself, if you don't do that, you cannot help others, because when you come into my space, anyone else's space, you are saying, this is my aura, this is my energy, this is my strength, this is how I'm feeling, and I'm bringing it into your space. If it's a trauma-laden energy you are coming in with, you're going to infect us because you've been infecting yourself. So what you want to do is, if there is anything in your life that does not serve you, throw it down with energy, throw it down with I care less for this, throw it down with everything you've got. Then pick up only what will serve you. Peradventure, you've thrown down and all of that's on the floor does not serve you. Don't pick any of it up. Go looking elsewhere for what you can pick up that will serve you. I hope this has served you. Thank you. My name is Kemi Oyeshola. I'm the founder and CEO of How to Think Global Solutions Limited. See ya.
All right. Thank you.
So I want to talk about the Kadas.
So let's take that off. Thank you so much. And Coach K. No,
in English, that's Yoruba. In English,
okay.
It is
Can somebody
throw it all down.
There we go. I'll take it off myself. All right. Thank you. All right. So thank you so much. So that is, so if you want to get a copy of the book, please make sure you leave, they're going to share a link with you so that you can get a copy of that. So share the link. I really appreciate that, that those of you who are all I ask is that you give a review of it once you have a copy of it. My hope is that it goes to all universities across so that people can utilize this. All right, thank you so much. And Esther, could you come up so we can bring up the next speaker?
Thank you, ma'am. Thank you to our dear Professor Merino for being such a gift to the world through our story of healing. I personally have read parts of the book, and you should read it Trust me, the story will encourage you to your journey of healing. Okay, for the second keynote for the Africa Trauma Care Conference 2025, presenting the topic From Surviving to Thriving, Transforming Trauma into Growth in the African Environment is Dr. Tolu Ajomale, a public health programs coordinator, administrator, and physician for the Lagos State Government. He is the head of special projects and mental health at the Lagos State Ministry of Health. Tolu plays a crucial role as director of the mental health program Lagos Mind, with insights into healthcare practices, policies, and programs in developing countries. Tolu Ajomale designs and implements public health strategies and interventions targeted at addressing current gaps and challenges in effective and efficient service delivery. He was instrumental in the Lagos COVID response, contributing to the Emergency Operations Center for Mental Health and Psychosocial Support and helping establish the Lagos State Mental Health Law. Tolu has developed and facilitated numerous mental health programs, championing partnerships and community participation to enhance mental health literacy and access to care. An alumnus of Imperial College London, Tolu has also received training from prestigious institutions like the Harvard School of Public Health and the University of Texas McCombs School of Business. Please welcome with me, Dr. Ajomale. Do we have him here? Okay, we have him here, but we can't see him.
Can you see me now?
Yes, we can hear you now. Yes, we can hear you now. You're welcome, sir.
Good afternoon, everyone. So I'll be speaking very quickly without taking too much of our time on the subject from surviving to thriving. But I think beyond anything, Prof has more than enough justice to the subject as it is. The only thing, just this amazing book. It's more than important now than ever before because we have gotten to that point in our narrative around improving access to care where we begin to look at what we can do as a people instead of further ado, just transforming trauma into growth in the African environment. I was very curious when I got the topic for two primary reasons, and I kind of understood the direction that Prof was going with this conversation, and reading from her book only further emphasized that point. Prof Marino, like I've known her, has always been an advocate of has always been an advocate for mental health, has always been an advocate for trauma care. But she, more than that, has been an advocate of being contextual when providing interventions and solutions. So for her to pick the topic, transforming trauma into growth in the African environment, I knew or had an idea of what direction this conversation is expected to go. And truly, we need to begin to have those conversations and examine these things from our perspective. Question I'd like to ask everyone who's listening now is, what if surviving isn't enough anymore, or is surviving even enough? There are three categories of people I would just quickly like to speak around: the people, the providers, and the system, because these three drivers are basically what makes a care system. And the people there talks about the people who need the service. The people there talks about the communities who have to deal with the burden of care. And we need to begin to explore how we change the narrative of how we provide support for people. Typically, if you have any traumatic event that happens to a family or to a person, as had been described by many of the previous speakers, the supports that we often provide are tied around the things that we can see. But what we may not fully realize is when they say, oh, the access to care gap is very wide. Sometimes I disagree because I think we are providing care without providing a title to it. I'll give you an example when I speak about providers. When I talk about first responders, this is the picture that comes into your mind. You're thinking about a policeman, you're thinking about a fire officer, or you're thinking about an ambulance provider or any kind of rescue official who would come to a scene of any kind of trauma. But how about we begin to reimagine what first responders are? How about we begin to imagine a first responder as a clergyman, a first responder as that grandma who sits in front of her compound and spews wisdom and spews words of comfort? How about we begin to explore first responders as a teacher or as a young person who lives with other people and can provide some kind of support for them? If we are going to begin to explore moving from surviving to thriving, then we begin to need to look at how, as a community, we can support one another, as a lot of the previous speakers had said. As we know, for us to go from surviving to thriving is more than just recovery. It's about getting your power back. And think about it in any context that you will. You had a really terrible, emotionally draining relationship that ended rather abruptly and traumatically. The goal of recovery isn't just to recover. The goal is to get your power back. If you have had to lose your job and had to struggle to try and make ends meet, the goal isn't to be able to pay the bills. The goal is to get your power back. And to get your power back, sometimes it requires us thinking beyond what the Westerners have proposed. It begins to allow us to think about what we can do for ourselves or what we have been doing for ourselves that we haven't labeled. Some of you will remember a few years ago that they described Nigeria as one of the happiest countries. And by its definition, the happiness there wasn't describing that we laugh all the time. No, it was describing our level of resilience. This is still the same country that has less than one psychiatrist to 100,000 people. It's the same country that has fewer providers. We have an 85% gap. In other words, if 100 people need help, only 15 people out of them will get clinical help from a Western provider. But yet we were described as the happiest people. Why? Because we were actually using care, but not in the way that we had described it, and we didn't label it. It isn't a mistake that a lot of our religious homes exist, where many of us have found opportunity to express a lot of the stress that we carry during the week. It's not a mistake that a lot of us have found our faith in the middle of distress and has helped us to thrive. I was at an event earlier today organized by one of the major media houses in Nigeria, and it was a mental health summit. One of the keynote speakers, who is a renowned professor here in Nigeria, had made one comment during his presentation to spark a reaction from the audience. And what he had said was, everyone has mental health. People laughed, and because, like you all know, when people hear mental health, they think mental illness. But we need to begin to change that narrative as well. No, everybody does not have mental health. No. Qualifiers are important because everyone has mental health doesn't mean anything. But we need to put the appropriate qualifiers, just like we are trying to do with our health system. The appropriate thing to then would say, some people have good mental health. Some people have poor mental health, and a few people have mental illness. That provides context. The use of one qualifier has changed the description of that terminology and how we understand it. The struggle to try and explain everyone has mental health has now changed because now you're giving context to it. And context is important. If we are going to provide care and therapy to the people who need it in our environment, context is important. I was at a TV session last week, also speaking around mental health, And one of the presenters had spoken about how therapy is important today and how a lot of people still don't believe in it. And I said that it's a process because we've moved from the place where people wouldn't even listen to the word therapy or talk about it on air. But now we've gotten to the generation of people who are more accepting of the concept of therapy. But that does not mean that we haven't been giving each other therapy. We just haven't labeled it. And perhaps what we need to do as a system is, as we provide access to care, we begin to also integrate what we know has always been working for us as a people. What parts of our culture, what parts of our faith can we use evidence to demonstrate its efficacy and integrate it as part of first response in any health system, so that people can go from perspective and take their power back. And so for us in Lagos, it is a thing of joy to be able to translate the message of mental health into the context that our people can understand, to use technology, but to drive it in local contexts, to be able to provide 24-hour telephone services to someone who only speaks Igbo because they want to be able to express themselves, or someone who needs to understand how they can promote their mental health using the things that they see and they know around them. So we need to progress, and I'm super excited to champion behind and support JARS, and especially Prof, in driving this narrative and driving this new message, and even through her book. And then we can ask ourselves the question again: what if surviving isn't enough anymore? Or is surviving enough? But I think it's a question that we all need to ask ourselves. There's an African proverb that says that the child who is not embraced by the village will burn it down to feel its warmth. It isn't really about the fire. It is about how it is translated to that child. So you need to not think about the child as being unruly, but the child was looking for warmth. For everyone who has abused a substance, it's a question of resilience. Everyone who needs care, what do we already have that we can use? And then how can we adapt with technology or with modern medicine practices to enhance care for everyone who needs it? So what story will you tell as a person? Will you be able to tell a story of survival or of thriving? Can you recognize the things that are around you that have helped you build resilience, that you haven't labeled, but have actually worked? For your time, I'll just end the session here.
Thank you, Dr. Ajomale. Thank you so much. Thank you so much. Always cool, calm, and delivering fire. Thank you for coming around, sir. We appreciate you.
Thank you. Thank you for the time. Thank you for the opportunity. Very grateful. Thank you, Prof, and the rest of the team.
You are muted.
Thank you so much, Dr. Ajomale. Next, we have Pathways to Healings, Addressing Mental Health and Trauma by Mrs. Grace Alexander, a dedicated advocate for individuals with disabilities in Africa, with degrees in English language and education from the University of Ife, Nigeria, as well as qualifications in social work from Metropolitan University, London. She has built a career as a compassionate champion for disability rights and social inclusion. Grace is the founder and CEO of the STAR Children Development Initiative, SCDI, an organization that provides support, awareness, and education to parents of children with special education needs and disabilities. She is also the co-founder for Fortitudo Coaching. Drawing on a personal experience as a parent of a child with special education needs and disabilities, She established SCDI to raise awareness about disability issues and advocates for the rights of disabled children. Grace is also co-founded Every Woman Matters UK Summit, a not-for-profit organization addressing issues for girls, women, youths, and individuals with disabilities in both the UK and Africa. She believes in the power of collaboration to empower individuals with disabilities and has worked with numerous organizations in the UK and Nigeria to combat discrimination, stigma, and stigma globally. She has received numerous awards for advocacy, including the Hack 300 Women Award in the UK. She is a trauma care specialist, a strength factory coach, and a published author. She's married to the prince. She's committed, I beg your pardon. She's committed to the principles of equality and social justice for all. Grace is happily married. You're welcome, Mrs. Grace.
Yeah, hello, thank you.
Welcome. Before Mrs. Grace says anything, hold on, Mrs. Grace, please. Before you move on, first of all, welcome to the stage. I just want to say, because Dr. Jamale was asking for questions, please, all of the speakers, hold on. There's a panel at the end, and you can take questions. Ms. Alexander, take the stage.
Thank you very much. Thank you very much, Professor Merino. I just want to say welcome everybody to this awesome conference convened by Professor Akindotu Merino. He's somebody I admire so much. He's somebody that has put a lot of meaning to my life, to what I've gone through, about what you've gone through in life. And I want to say thank you for allowing us to actually introduce our book, which is called We All Need Healing. Actually, she is the one who wrote the foreword of the book. So I'm going to share some. Can you share my slides, please? Hello? Hello? Can somebody share my slides? Are you hearing me? No, this is not mine. That's not mine. That's not mine. That's somebody else's slide. I sent it to Jazz yesterday. Adebimpe said I should send it, which I did. That's not my slide. That's not my slide. So put my slide on, please. You have taken 5 minutes of my time, so that will be added. So the title of it, the thing is Pathways to Healing from Trauma and Mental Health Experiences. So what I will say is that life, we embrace so many seasons, so many changes. Are you not showing my slide, which I sent yesterday? Adebimpe, you said I should send it to Jazz email. Anyway, we go through a lot of this is not on. So we face a lot of adversity, we face a lot of loss, we face a lot of, which includes exhaustion, which includes confusion due to the experiences we actually face in life. And then we face a lot of sadness due to losses, we face a lot of anxiety, we face a lot of agitation, numbness, emotional numbness, disassociation, confusion, which actually tends to affect us as human beings. And nobody is immune to what is going to happen next. Life is full of uncertainties. And one of the things is that the reality of today's challenges challenges can feel overwhelming and can affect our behavior, how we behave, how we relate to other people, how we act. That some people act out of the fact that they are people's pleaser. Some people, because they don't have secured attachment when they were young due to the loss of their parents, they face a lot of that, and that affects the way they relate to the world and how they see themselves. So there's a loss, there's kind of loss of belonging, loss of identity. Who are you? Like when you come to Britain, because of racism as well, you start thinking, who am I? and then you don't know who you are, and then you start having this emotional imbalance, then that affects the way you relate to other people, because you are not actually understand your worth as a human being, and that can lead to the effect of this. These are mental health issues which which can lead to depression, which can lead to anxiety, and which can also lead to trauma-related disorders. And one of the things, the statistics according to WHO, that is World Health Organization, says 1 in 8 people are experiencing mental health issues and trauma-related. That's quite huge. So I'm going to talk about why we need emerging pathways, because I told you the title of our book is We All Need Healing, Emerging Pathways to Trauma and Mental Health Experiences. So why do we? Because of what is happening in the world, because the mental health issues, there's global rising of mental health issues are really rising, and it's affecting, there is a lot of since COVID. So that means traditional systems are overwhelmed, underfunded, they are inaccessible, especially in low and middle income countries. One of the things is that then standard clinical approaches often focus on individual symptoms rather than social, cultural, and spiritual of trauma. For instance, many African countries and community-based settings, people seek healing not just from therapy, but from their faith, from their family, from ritual, and from their traditional healing and all sorts. And then another thing why we need this is that any pathway must be culturally relevant, like other speakers have said, and be inclusive, because trauma looks different across culture. How people see trauma, they are different. So that will be inculcated into their approach, into approaching them. So for instance, in Nigeria, they talk about storytelling, they talk about community reconciliation, they talk about, I think I'm on slide 3 now, or 4, spiritual cleansing, collective support, which restore dignity, identity, and social cohesion / integration. So any part of healing must include value spiritual faith, such as faith-based counseling, like as a Christian, as Muslims, as somebody who believes in traditional alternatives. So many African countries embrace faith-based and indigenous healing models, which address moral, emotional, and spiritual aspects of suffering, complementing modern therapy. So they're all woven together. So now, benefits of different emerging pathways. Why this is important? Embracing that means that we're embracing emerging approaches. That is, it's not one cap fits all. So there are so many approaches which empower individuals, communities to become active participants in their healing rather than passive recipients of care. And one of the things is that the emerging approaches also promote resilience, social justice, belonging, especially for marginalized or traumatized population. Like, I'm a disability advocate. I realized that when I had my son, I first traumatized because my son was diagnosed when he was 7 with epilepsy. And you know what epilepsy is? Oh, it is contagious. It is this. And there was 2 things that affected me, fear and shame. It was really traumatizing. It took me 7 years of recovery for me to be able to achieve whole, to change my perspective and be able to bond with my son. So you can see that they feel also traumatized. So another benefit of these pathways, which is in our book, is that they do not approach mental health issues and trauma experiences. They don't only approach as a clinical issue alone, but as a shared human experience that requires empathy and compassion. So that's why I started Start Children, for people in Nigeria and for people that are in diaspora, Black ethnic minority group, to start telling them, because mental health and disability, and if you are a parent of a child with disability, you're effectively disabled, as somebody as Buki Ayinde has said. So, and that thing affects the way we relate to our world, the way we see our children. Some people, they hide their children because of that disability. And you hide yourself because you are not integrated. You feel isolated. You are seen as an outcast, which is not in the best interest of your own well-being. And some people, because thank God for England, I mean, there where they put a lot of, I live in England, where they put a lot of services in place for parents of children with disability who are going. And you know what? This, when you have a child with disability, or when you have a disability, it affects your family dynamics. It's either your marriage or your child. So you are stuck in between. So there's this kind of sadness, there's this kind of isolation, social isolation as a parent of a child with disability, and all sorts. So all these are, and that's why you can choose whatever approach that befits you, and that can change your mindset, and that can align with your to you achieving wholeness, and for you to thrive as a parent, so that you don't see that you being a carer or being somebody that has undergone through something traumatic defining who you are, but for achieving wholeness. So, and then you have to be kind to yourself too. You can't be, because if you are not kind to yourself as a parent, it starts affecting how you bond with your child. So some people, they bond their children out of fear or out of shame, and they are hiding and they are not fulfilled. I'm a testimony that I've been healed. I've written about 3 books, and that's the 3rd book that is coming out, and I've been able to inspire. Our life is about impact. Other parents that are in my shoes, and other people who are actually with disability as well. So benefits of embracing these emerging pathways, which give rise to emerging approaches. 1, it recognizes, that is, I'm talking about our book, it recognizes the spiritual, the communal, the familiar, and the ritual dimension of healing. So healing is not one way, it's not a one-way thing. It's not one cap fits all. It depends on your circumstances. It depends on what approach fits your situation and what approach you are comfortable with. So emerging pathways adopt holistic model in order to achieve wholeness, such as body, that is medical care, mind, that is psychological care, spirit, that's faith and meaning, and community, that is social belonging, so that you don't feel ostracized and you don't feel left alone. You don't, because when you are traumatized, one thing is that it disconnects you from your community, it disconnects you from yourself as a human being. So it's about finding who you are. And one of the things is that you don't need to live in a default mode. You don't need to. You have to leverage on the people, and then acknowledge your pain. How? Acknowledge your pain. Be honest about your pain. When you are honest, then that's the first stage of healing. You acknowledge your pain. You are honest with your pain. You are not hiding. If not, they will rear their ugly head later. When you hide your pain, when you acknowledge your pain, it's not a sign of weakness. You can't suppress your pain. You need to acknowledge, so that you'll be able to manage your feelings. You need to manage your emotions. That's very, very important. So in conclusion, I would say we need emerging pathways. That's the title of the book, which I'm talking. And I will tell you why the book is also very important, because healing from trauma and mental health challenges require more than medication or talk therapy. It requires holism. It has to be culturally sensitive, and it has to be community driven approaches. These are all in the, there are 16 chapters in that book, and you can choose any one that fits you. So, and these new pathways which we are put in that book integrate the mind, like I said, body and spirit, and reconnect people to their communities, and help return meaning I told you when I did this trauma thing, Professor Merino, actually, in my first book, I acknowledge her that you actually restore meaning into my life. And one of the things I want to, and remaining, and dignity. And now I'm proud of my son. There is a kind of mind shift from the biblical point of view for me, because from the biblical point, because I'm a Christian, and that works for me. The one that says you are created in the image of God. My son, my last child is 30 years plus now, going to 31. And I'm blessed that I was able to change my mindset when I was ready. So, and it restore hope for the future. Because one of the things is that when you are traumatized, you lost hope for the future. You are not, your body, your soul, your nervous system is dysregulated. You are not connecting with people, and you are responsible for your healing. So, like I said, you cannot be living in a default mode. You have to leverage on other people, and you have to know who you are. What exactly are you looking for? And you, like I said, you have to actually make sure that you are not acknowledging. And I would like to, because Professor Merino mentioned about the forward of wrote the forward of the book. So I'm going to read an extract about the book from Dr. Merino. I want to thank Dr. Merino for giving us to share, to actually be able to say much about this book. I really appreciate that. I want to start quickly read just a paragraph, please. Please pardon me. I'm trying to, but you wasted my 5 minutes. So add the 5 minutes.
That time is up. We already gave you extra.
Hold on. Let me finish. Don't interrupt me, please. The book widens the lens, presenting, that's the quote from the book from the forward by Dr. Merino, who said, the book widens the lens, presenting pathways that move beyond any single tradition. Readers will find psychological approaches like cognitive behavioral therapy, psychodynamic work, alongside alternative practices such as arts. And in one of the books, we wrote about how trauma affects us. We wrote about why we need healing. We wrote about unleashing your creativity. All those things are necessary. And we wrote about self-help techniques, which can help you, because healing starts with you. It starts with you, like Dr. Merino mentioned about the individual. Who are you becoming? That's the question I'm living with. With all the things, life is full of uncertainties. As one is going, another phase, another season is coming. You must be bold enough, because even when you are resilient, it doesn't mean comfort. It just means that you can rise above anything that come your way. So once you've healed in one, that strength you've used to that you embrace in healing the one, when another one, it becomes easier. Thank you very much.
Thank you very much, Madam Grace. We appreciate you for your consistency and your willingness to always come to talk to us. We appreciate you very much, ma'am. Thank you once again, everyone. If you're still here, please put in the chat, say thank you to the speakers who have spoken. And if you need the link, we'll still post it, excuse me, in the chat, so you can request for the free ebook by Professor Merino. Next, we have The Power of Community and Community-Based Trauma Care Approaches from a Kenyan Context by Steve M. Mathenge from Nairobi, Kenya. He is a religious leader who holds a bachelor's degree in Bible and theology from Triumphant Christian University, besides being a certified professional. Do we have, okay, he's here. All right. Let me bring him up before I continue. Yeah, so besides being a certified professional mediator, he is also a trauma care coach and a community mobilizer. Welcome, Pastor Stephen Mathenge. Over to you, sir.
Thank you. Thank you so much, Esther. And also thank you, those who have spoken ahead of me. It has been a great time so far. Well, I'm going to take shortest time possible. I'm going to be brief, concise, and direct in the interest of time. We can go to the next slide. I'll be speaking on the power of community and community-based trauma care approaches. And I'll be looking at this from the Kenyan African concept of trauma healing that is known as Harambee, which actually means pulling together. Let's move fast. So, Madam President, the African Trauma Care Conference founder and convener, my fellow coaches, friends who are tuned in, leaders, ladies, and gentlemen. Greetings from Kenya and Africa, the continent that knows the meaning of resilience, not as a solitary journey, but as a shared value.
Okay, I think he's having some technical issues. He'll be back shortly. Okay. Oh, okay.
Esther?
Yes,
if
ma'am.
we, it looks like we're having technical difficulty with Reverend Stephen. And if that's the case, you want to call the next person?
Okay, I'm checking if she's here. Yes, she's here. Okay, while we wait for Pastor Stephen to get back, we will move on to trauma healing in Christian. Oh, sorry, I missed that. We'll move on to trauma. Next is Silenced Words, Trauma, Culture, and Religious Narratives in Northern Nigeria by Elizabeth Shem Lawrence, a mental health and gender advocate and an experienced traumatic stress care practitioner and trauma care coach dedicated to helping individuals heal and build resilience. With a strong focus on trauma-informed care, she equips clients with practical tools to manage stress, anxiety, and emotional challenges, creating a safe space for growth and recovery. Her experience as a gender and human rights expert at the Kaduna State AIDS Control Agency deepened our understanding of the link between mental health, gender equity, and human rights. Committed to social justice and emotional well-being, Elizabeth leads workshops and training sessions on trauma and mental health, empowering individuals to reclaim their stories and live healthier lives. She is married with 3 children. Welcome, Elizabeth, and happy birthday again to you.
Thank you so much. Good afternoon. I really find it an honor to be here today to celebrate my birthday. It's my birthday, and I don't think I would have been anywhere better. I'm happy to be here today. Good afternoon, everyone. My name is Elizabeth Audu Lawrence, and I'm going to be speaking about silence wounds, trauma, culture, and religious narratives in northern Nigeria. Next slide, please. So we have the culture. Is that the second slide?
Yes, it is.
Let me get you from here. Oh, yeah, it is. Okay, we have the context is violence, displacement, and hidden suffering. So in northern Nigeria, we have endured insurgency, banditry, and communal conflict that force families to flee overnight. That's if they survive it. Displacement, loss of livelihood, and prolonged fear leave deep psychological scars that are often unseen and untreated. Next slide, please. So the culture of endurance, strength and silence, faith is what is very key for us in the North, especially the culture of silence. You know, in northern Nigeria, from childhood, many of us are taught to endure silently, trust God, be strong, move on. These messages are loving. Yeah, they think they are comforting us, but can become barriers to acknowledging trauma. And pain is often reframed as moral or spiritual failing rather than a human response to harm. So in northern Nigeria, we have this culture of for people that know or have lived in northern Nigeria, you would know that even when it comes to giving birth, if you have met a northern woman that is culturally inclined, she is taught not to even scream or make any sound when she's giving birth. So they say it's a sign of weakness when you're going through pain of labor and you shout, that they see it as a weakness and not a strength. So women are encouraged not to even shout or make any kind of sound when they're giving birth. So you can imagine how the culture of silence is very strong in this part of the country. And of course, it comes mostly from our faith. And next slide. So the next is spiritualization of pain. And of course, it's a double-edged sword, source of strength. They feel that faith provides meaning, comfort, and communal support, powerful resources in recovery. Then barrier to help, interpreting trauma solely as destiny to faith test can close access to mental health care and safe expression. Opportunity. When faith and trauma-informed care are combined, healing is culturally resonant and more acceptable. Next slide. Sorry, I don't intend to take your time. I just want to quickly run through it. So I would be talking about two witness stories. At least I wouldn't say I was there, but I have spoken to people that were involved in this story. And the first is a family that was attacked in Maiduguri. I personally know the family. At least I met them after their father died. Their father, they lived in Maiduguri. Their father was a vet doctor. And there was this night the attackers came in, and right in front of all of them, their father was laid and slaughtered like an animal right in front of all of them. And because of that, the mother, again, because of our culture, she couldn't really grieve or express grief. And as a result of that, she developed high blood pressure, and she too couldn't survive the death of her husband. She died 2 years after leaving the 5 children to fend for themselves. And they had to be left to stay with relatives. Sometimes they had to stay alone, and when the brothers, in fact, there was a particular brother of theirs. On the day the father was buried, on the burial day, the brother was acting like, like nothing happened. And they were wondering, you just lost your father. Why are you acting like nothing happened, But it's because they don't realize that he's going through a form of trauma response. but they saw it as stubbornness. And another story again was about a fleeing woman. This story was told to me by one of my close colleagues, and she was carrying her baby, an infant who was a few months old, and the other one was already a toddler, and she was fleeing. And there was a point that she got tired, and she just saw these herders in the bush. She had to make the hard decision of letting go of one of the children. And that was how she gave these herders the baby in her hand and told them that, please just take care of my child. And she continued running with the other one. And this comes to mind of the story of how in the Bible, how God describes how he would never leave us. He used the story of a mother. So imagine the painful decision of a mother to have to give up her child so that she will be able to survive from terror. And I can imagine how that has affected her till this day. Next slide, please. So what are the key challenges in the North? Of course, we have worked in the HIV and AIDS response. I have worked in human rights, and I know we have a serious problem with stigma. And for stigma, it's so bad that in communities where they find out that people are HIV positive, they actually banish you from the community. They will ask you to leave the community, that they don't want you to infect them. So it was a serious work for us that period. We had to go into those communities to create awareness, to let them know that people don't just contract this illness just by talking to you or by hugging you. You know, we had to go and sensitize the community before they were able to understand and, you know, let those people back into the community. So in the North, we have stigma and silence and trauma hidden behind spiritual language, and it is because of fear of shame it limits disclosure. And I remember there was one time I asked a lady, why is it that when your children are raped, you people don't go all out to fight, or you people don't talk about it? And one of the things she told me was that is because no one is going to marry their daughters. And you can imagine how for us here, the culture is a big thing for you to give out your children in marriage, you know. And that is one of the reasons why people are silent, and stigma, of course, is the driver of that silence. Then we have limited local services. We have very few trained providers in conflict-affected areas. And we have language barrier, and we have access barriers. And when I say access barriers, it's very bad because there are some communities that till today, I was in a community recently that did not have even one like a primary health care or a clinic, even one, as in there was no presence of any health provider in that community. And we have the faith-first responses. We have well-meaning religious responses, and they may lack trauma awareness and referral pathways. Next slide, please. So principles for culturally sensitive trauma-informed responses. Create safe listening spaces. Of course, we have all been talking. When we talk about trauma, we know that the healing starts when people feel safe. When they feel safe, that's when they begin to open up and talk. People need to know that there's confidentiality in what they're telling you. They need to understand that you're not going to judge them. And we need more women and youth-specific groups where people can confidently tell their stories without being named or shamed. Then build local capacity. Train religious and traditional leaders in psychological first aid and referral protocols. Then localize psychoeducation. Provide materials and sessions in Hausa, Kanuri, Fulfulde. Here, I added my tribe here. That's the name of my tribe. I'm from a place in Kaduna State, and we're the Ham people, but the name of our language is Hiam. I had to add it here. And Mogavul is a community in Plateau. And these people I'm talking about, like the Mogavul community, if you have been in the news recently, you would be hearing about attacks in Mongo local government. And that is where the Mogavul people are. And that is where my husband is. That is where my children are from. So I had to include that we have to have materials in those languages to help reduce stigma. Then integrate systems. We should coordinate health workers, schools, faith institutions, and NGOs for consistent trauma awareness responses. I think it's the last slide. Okay, community bridge for healing. That's program model. So we should have training modules. Safe spaces and mobile outreach. I think these communities, we have to make more efforts to reach them, and this mobile outreach, I think, is very important because it's something that we can plan to do once or twice in a year to be able to reach those communities. Next slide, please. So this is just like indicators. I try to put indicators. They prioritize access, capacity, and community-led support rather than only clinical symptoms. Next slide, please. So call to action, from silence to shared healing. We should train and partner with faith and traditional leaders in trauma awareness. For the North, we call them here, I don't know what they call them in other parts of the country, but we call them the gatekeepers. And when we say gatekeepers, these people are really the gatekeepers. You cannot penetrate any of these communities without going through our faith and traditional leaders. So it's very important to go to them, create awareness, and once they understand what we're trying to bring to them, they will in turn talk to their people, and their people will accept whatever information we're bringing. Develop locally translated psychoeducation and safe spaces for disclosure, like I said. Support integrated pilot programs that connect faith, community, and mental health services. Invest in monitoring that values, dignity, language access, and survival leadership. I think that's the last slide. So thank you very much for listening, and thank you for having me.
Thank you so much. That's a really great presentation. We appreciate you. And that's a good work you're doing in Northern Nigeria. All of those stories are so heart-wrenching. We believe for healing. Thank you so much.
Thank you for having me.
Next, we have Trauma Healing in Christian Men, the Challenges and Impact on Families by Mr. Olufolajimi Kuti. Mr. Olufolajimi Kuti would like to know if you're here before I continue to read his bio. Can someone let me know if he's here, please? All right, thank you. He is someone who brings unique blend of financial expertise, spiritual grounding, and compassion for human growth and healing. Mr. Olufolajimi Kuti has built an impressive career spanning more than 25 years across the capital markets, securing trading, investment management, investment banking, and private wealth management. He is a fellow of the Chartered Institute of Stockbrokers and authorized clerk of the Nigerian Stock Exchange, and holds an executive MBA from the prestigious IESE Business School, University of Navarra. In his current work, he partners with elite families of African descent, helping them steward their wealth toward transgeneration significance and impact, integrating purpose with prosperity. Beyond the boardroom, Mr. Kuti has a deep commitment to faith and emotional wholeness. He has basic training in ministerial studies from Rema Bible Training Center, Nigeria, and completed the trauma care training program with Jazz Educational Institute. He also serves faithfully on the leadership team of his local church. A devoted husband and father. He resides in Lagos, Nigeria, where his life's work continues to blend excellence, service, and transformation. Please join me in welcoming Mr. Olajimi Kuti, a man who brings both head and heart to the journey of healing, purpose, and legacy. Over to you, sir.
Okay. Good afternoon. Let me confirm you can hear me.
Yes, we can hear you, sir. We can hear you loud and clear.
Okay, fantastic. So I'd like to stand on existing protocol and thank Professor Marino and the excellent Jazz family for this opportunity to speak at this esteemed conference. While thinking about how to best share my thoughts and engage with this topic, I sought the consent of an existing, well, a current counselee to share his story. Well, it's an ongoing story. Certain details will be modified, but the essence of the story remains intact. So let's call him Odunayo. Now, so for about 8 years, Odunayo experienced the most vicious attacks on the two things he held the most valuable when it came to his professional career. And then after that, there were about 2 years of protracted and sustained grief, if we were to put it like that, including the loss of a loved one, which really put him under a lot of pressure. He eventually lost his job and then continued trying to engage, continued to hit certain setbacks, and after a while, he became a shadow of himself. He was an active member and still is an active member of his local church, and they did step in. They helped him financially, they helped the family, friends tried to connect him with business and opportunities, but something had broken. Something had broken, and nobody could understand why he wasn't getting on with it and just move on with life. About the time I met Odunayo, he had undergone about 6 to 8 years of this, and I had just completed the training with Jazz, and it was a chance meeting, and we got talking. After listening to him for about a few hours, you know, that definition we got in our training about how trauma and when you have poor mental health, and you know, that whole reality about not being able to cope with the normal stresses of life, or when you experience trauma after a sustained and prolonged difficulty or pressure, which for him classically was completely unfamiliar. He had gone through challenges, but in his case, this time it was different. And it was beginning to take a toll on his family. It was beginning to take a toll on different relationships, and he was at a low point. So when we met, I realized one of the first things we did was to help him understand that these were things that happened to him. We helped him realize that this wasn't unique, that this was something that was not uncommon to the human experience. Because at the time, he did feel like a failure. He felt like he had let everybody down. When we talked over sessions, like, for example, it was very infrequent. Talked over different times. He had begun to have things like ideation when it came to suicide. And it was a bad place. So the first thing was to help him understand that this was something that happens to him. He was a man of faith. The trauma training helped me look at the scriptures in a completely new light. And I was able to share that with him and say things like, hey, do you know that this great apostle, when he was talking about despairing of life, when he talked about having the sentence of death in themselves, do you know that that was someone who was going through a mental health challenge? Told him things about an Old Testament prophet who just said, God, take me home. And I said, but when we read about these people today, we see them as heroes of faith. And that was something that began to help him. But then there were other challenges. His family was suffering financially. It was taking a toll on his marriage. There were things like, and he had no clue. And the real problem was that he didn't know how to be able to communicate to them, and nobody understood what was going on with him. He didn't even have the tools or the language to understand himself. Talk less, communicate with his wife. So it took a while to be able to help him understand what was going on. If I were to borrow from our first keynote speaker, I think when I see it was akin to what a psychological amputation, and he needed to be able to accept the gravity of it. Like I said, it's an ongoing story. We went through processes such as being grateful that he was alive, being able to find forgiveness, because the more he understood what happened to him and to realize that it wasn't his fault per se, he began to feel a bit of resentment against those who did not understand him. He thought, these people should have been a bit more compassionate and that. And I had to let him know they only knew as an in fact. I told him, by the way, if I hadn't gone for a particular training, I might not be able to help you. So do not blame the people. Let's find a way to forgive them and then be able to find healing for yourself. It was difficult for him to accept his role in the things that may have happened where there could have been better understanding. It was important to get him to a place where he had a renewed or refreshed sense of identity, and then to be able to build some internal fortitude. Now, this is something that took a while, because he was now getting to the place where he could, now I'm talking over years, I'm compressing a number of years into this 10 minutes discussion, where he could now begin to communicate with his family exactly what was going on. And let me give an example. So recently, this was about a month or two ago, he came and then we caught up, we meet infrequently. And he said there was an interaction with his wife that proved to him that he was making progress. And I said, what exactly happened? He saw that his wife was in one of her quiet moods, and he tried to engage her. And because it was one of those times when she was feeling the pressure, when these things happen and then it looks like the economic burden is shifting to the spouse, he said at this point she exploded and she let loose and she gave expression to the frustrations and all. And he said for the first time in many years, he reacted completely differently. He listened to her, he empathized with her, he spoke with her, he was able to communicate and be able to help paint a picture that, look, he is recovering, and be able to assure her in a way. And he said that she looked at him and said, clearly things have changed. When he was going through difficult times, he did express frustration with people of faith. He expressed frustration with inadequacies, and it was important to find forgiveness and understanding for all of that. So in terms of communication, being able to now engage, because it was a case, I told him, when you fly a plane and there's any casualty, the first thing they say is put your mask on before you put a mask on your child. I said, even though the pressure about taking care of your family is real, if you are not whole and recovered, there is no way you're going to be able to fulfill those roles. It's true that they may feel frustrated. It's true that they may feel impatient, but let's focus on you first. It was difficult because he felt that he was being irresponsible. It took a while for him to be able to break through that. And we're still working on it. So we're at the point where he's beginning to be able to start to move forward, a refreshed sense of identity, and then getting to the point where he can take responsibility and then make healthy choices. I'm glad to have been able to make a difference with this person and other men like that who I didn't ask for consent to share their story. So thank you, Jazz. Thank you, Prof. Thank you, the Jazz team. And we pray that. And thank you, Prof. for Kadasile.
Thank you, sir. Thank you so much for coining your expertise to attend to men, because we really need to focus on our men. And we are hoping that you're ready to speak to our men next month for Men's Mental Health Month. Thank you
We
very
are
much, sir.
grateful.
We appreciate your insightful presentation. Thank you so much. Okay, moving on. If you are still here and you are not tired and you have been enjoying the sessions, yes, in the comment section. We would love to see your comments. Right now, we are moving on. We will bring back Pastor Steve soon. But for now, our next speaker is Dr. Mustafa Toyin Sombe, fondly known as the Ebora of psychology. He is a trailblazer and one of Nigeria's early pioneers in counseling and clinical psychology. Dr. Sombe has served in some of the nation's most critical moments as consultant psychologist to ECOWAS during Nigeria's Ebola crisis and to the Nigeria Leadership Initiative following the Dana air crash of 2012. He has also advised the Nigerian Psychological Association on volunteerism and continues to mentor young psychologists across Africa. Known for his eclectic and Afrocentric performance, known for his eclectic and Afrocentric approach to therapy, Dr. Sombe blends cognitive behavioral therapy with African psychophilosophy, grounding healing in cultural wisdom and personal empowerment. His work spans emotional intelligence, anxiety, relationships, and youth counseling. With a passion for helping individuals and communities build resilience, an educator at heart, he has taught all levels, serving as pioneer principal of Eman College, a university counselor at LASU, and later a clinical psychologist at the Federal Neuropsychiatric Hospital, Yaba. Today, he serves at Summit University, Offa, as lecturer, head of counseling unit, and director of sports, where he led the university to participate in the 2022 NUGA Games. Dr. Sombe earned degrees from Lagos State University, the University of Ibadan, and Obafemi Awolowo University, where he completed his PhD in clinical and health psychology. He is a proud member of CASON, NACP, NPA, and the American Psychological Association, and is the Lagos State nominee for the 2024 CASON Fellowship Award. A respected media voice and family man, he continues to inspire through his dedication to mental health, education, and Afrocentric healing. Ladies and gentlemen, please welcome with me Dr. Mustafa Toyin Sombe. You're welcome, sir.
Hello, how are you?
Fine, thank you, sir.
It is my pleasure being here, and thank you very much. Am I seeing the face of Adebipe?
Yes, she's
Hello.
in the studio, sir.
Professor Marino, I should be grateful.
Yes, she's also here.
And, okay. Then let me just zoom in on so that we can save time and allow time for interaction or panel discussion.
Okay.
As we should know, trauma can be really very terrible. It's sort of a blow to the individual or community who is experiencing trauma. By African perspective, more often than not, traumatic experiences are not issues borne by individuals in their individuality. It is either borne by family, extended family members, communities, and things like that. And when this happens, it precipitates or predisposes the individuals experiencing trauma to pain, stress, sometimes poor sleep, high irritability, and exceptional conditions of maladaptive behaviors, where concerns of irú èwo leléyìí by Yoruba descent psychophilosophy. What is this? Something bordering on mo gbé, mo kú, mo dáràn. And when trauma occurs, you will see that certain conditions will be experienced. But it will not be out of place to look at what can cause trauma to the African community or individuals, and some of which can be road traffic accidents, as we are now having in our community, and geopolitical dictionary, kidnapping, banditry, loss of cows, loss of pets, sexual abuse, divorce, childbirth, war. Being an eyewitness to a traumatic event itself can be highly and exceedingly traumatic. Airplane crash, just as whilst my citation was being read, we have had a Danaya crash episode. And maybe I should like to let you understand that at that point, there was a lady who lost her husband. And for 3 months, all the members of the family were on this lady's neck, not allowing her to mourn or cry until she was presented to me in the clinic. And when I asked her, what do you want now? Guess what? She said she would like to cry for the loss of her husband. Over 3 months, you have not cried? She said yes. That everybody who had relocated to sleep around her have always been persuading her to say, don't cry, don't worry, we'll be there for you. So you can imagine that in the way Africans will try to see trauma, they feel it as a joint project, as a community feelings. Flat tire in the dark or a jungle area can elicit exceeding trauma. Examination failure, students or young people, adolescents can decide to, even sometime beyond precipitating depressive symptoms, they can walk away from home, thereby extending the traumatic feelings of where can this child be. Loss of valuable items. Loss of a child, and then maybe more commonly that people will be expecting beyond the ones that I have highlighted. Loss of a spouse, loss of a job. Conditions that can precipitate traumatic experiences are enormous and deep. Even the loss of a king by African tradition is traumatic to the extent that the community will declare a curfew. In Yoruba parlance, they call it Oru. In other words, a divinity that is excluding the women from walking around, and any non-indigene who walks around may be used for whatever reasons. In other words, the community is feeling the pain, the strain, the stress of a loss of the head of the community. It will not be out of place for us to look at essentially major types of trauma, which can be acute, which can be chronic, and which can be persistent or complex. And these are dynamics of what we try to see in the clinic. For the African, just as my topic, which raises Afrocentric perspectives on trauma and trauma care, we'll see that for African trauma care, just like I have mentioned earlier, family support is one. And this family support is not limited to the nuclear family support. It is generally known and classically so that Africans are essentially communal before the disintegration of that. In the Afrocentric perspective to trauma care, relocation from sites of trauma or community of trauma is a strategic way of caring for the traumatized individuals, so that perhaps removing the individual from sites of trauma, just as it is now established in the standard approach to traumatic care by international best practices, removing the client from the site to avoid flashes. So that is why some of us have come to essentially try to understand that psychology and psychological well-being is not limited or sacrosanct to be aligned with Eurocentric psychophilosophy alone. We might not be able to say that so far we have documented this, documented that. Yes, but it does not mean that each individual, communities, countries, societies in Africa have not been existing and caring for their own in terms of health and ill health, including traumatic times. Exposure to traditional healers. By African approach, members of the community have their specialty in occupations and trades. There are those that we call Alagbo. There is Baba Alagbo is herbalist. Babalawo, that is a spiritual consultant. Onishegun and Babalawo, Onishegun, Babalawo and Alagbo, they work hand in hand to facilitate the treatment with the use of herbs. For example, poor sleep. Poor sleep can be achieved using various herbs known in our African setting. And you can find that successfully well documented by phytoscientists, African-oriented phytoscientists. That means Africans who have studied the plants in Africa and applying such to treatments. Healers, various healers come up. Beliefs are respected. If an individual is a believer in Shango, that is the god of thunder, the Shango priest will be invited. And there is a philosophy that is linked towards that, which is like Omawo Obodo Shebi Omo Ogberi. In other words, anybody that belongs to a particular cult should never be treated as belonging to another cult or no cult at all. And the way an individual will experience trauma varies, or the community experience of trauma varies from community to community. I take Nigeria, for example. In Yoruba community, if a young person dies, it is regarded as ofoshe. Ofoshe means there is a loss of a young individual. And there is a difference between ofo and oku arugo. And within the same Nigeria geographical location, you have the Igbo communities who, when they lose their young ones, they drink, dance, and wish the child away. Unlike the Yoruba community, when they lose a young one, they go into their shell, expressing sober feelings, high irritability. And when they lose the older ones, they make it Okwayeye, which means is a celebration of death or transition. Unlike in the Igbo community, where when the elder dies, it gives them real deep psychological traumatic experiences. And having done research over time along this line, the Igbo justification is premised on the fact that the young one had not made them to spend so much to grow the child. So not so much had been wasted. But the elderly one that had died had touched many lives sufficiently to experience the goodness of that individual. Unlike in the Hausa community, head or tail, once anybody dies, it's inna lillahi wa inna ilayhi raji'un. That means from God they have come and to God they have returned. All of these are issues and dynamics. I have decided to give this umbrella position. It does not mean that the way that an Ijebu will hold ceremonies for the dead is the same and equal with the way an Egba will hold it. But more commonly in the Yoruba ties, that is the way it is seen. More commonly in the Hausa ties, that is the way it is seen. Now let us see certain emotional responses that may follow on trauma and traumatic experiences. Confusion will arise, fear, anger, high deep sadness, and so on and so on. Physical responses may include gastrointestinal concerns upon hearing the news of the death of an individual. The close-knitted family members may start running stool. That is what I mean by gastrointestinal concerns. Aches and pains of unknown origin, sweatness, blurry vision, and so on and so on. The behavioral responses can be high-pitched tone. An individual becomes highly irritable and shouts at every turn and make life difficult for others or make life difficult for himself. And more importantly, when an individual is recovering from traumatic experience in African setting, especially of Yoruba descent, it will be posited clearly and is in consonance with the best practice that an individual who is sick and has loss of appetite, if the individual has improved appetite, there is a hope giving. And that is premised in Yoruba psychophilosophy of ara aya oya, ẹ̀kọ́ ń wọlé, ewé ń jáde. In other words, you are saying that mama had been traumatized, sad, depressed, but thank God you can now echo is a solidified cornmeal that wrapped in leaves. With that, you are bringing in the solidified cornmeal wrapped in leaves, and only empty leaves is coming out. That is hope. And that is the way we give hope. And for further advancement in exploring trauma care, we may look at Deborah Togol et al. In the Journal of Trauma Nursing 2017, talking about improving care improving trauma care in Africa. And let me wrap it up by letting us understand that in Africa, health services are expensive, especially modern health services are expensive. And more often than not, most communities do not have health insurance, so services are procured out of pocket. With this, I want to say a very big thank you to my audience, and I am open to advanced questions. Thank you very much.
Thank you very much, Dr. Sombe. That was very articulately presented and insightful as well. Thank you very much, sir. It's a pleasure to listen to you and have you always on our conferences. Sorry about that. Okay. We can see all your comments. If you have questions, please keep, and we have been seeing your questions as well, so please keep them coming. There's going to be a panel session and some of the questions will be attended to. But right now, before we go into the panel session, we are going to bring back Reverend Steve, Pastor Steve. I believe he's here. Yes, he is. So we have introduced him earlier, so he will just do his presentation now. You have the stage, sir.
Thank you so much, Esther. I'm set to go. So in the interest of time, I move fast and make my submission, and we shall be good. So I'll be speaking on the power of community and community-based trauma care approaches, the Kenya African concept. So, Madam President, the ATCC founder and convener, fellow coaches, friends who are tuned in, leaders, ladies and gentlemen, greetings from Kenya and Africa, the continent that knows the meaning of resilience, not as a solitary journey, but as a shared value. We stand here today under the powerful banner of Pathways to Wellness, an African global perspective. And in a world that often measures healing in isolation, in the quiet room of a doctor or a therapist, and the sterile walls of a hospital facility, we must ask ourselves and the world, where does genuine and lasting wellness truly take root in the African context? We say it does not begin with an individual diagnosis. Rather, it begins and endures within the collective soul of a community or a society, so to speak. And that is why now I would like to delve into a very unique Kenyan African concept of trauma healing approach that is known as the magic of the spirit of Harambee, which means all pulled together, which is an infrastructure for trauma wellness employed locally here in Kenya under the national motto or philosophy of Harambee, which is a clarion call slogan, meaning let's all pull together. Historically, Africa has borne some of the greatest and unforgettable scars of conflict, civil wars, displacement, poverty, and numerous scourge of pandemics. And I would want to say here that Kenya has not been exempt from this. time to time, there are pandemics, there are tragedies that occur, there are post-election violence. In our neighborhood, we have witnessed civil wars in Congo, Rwanda, the infamous Darfur, and even the currently ongoing civil war in Sudan. And therefore, if our resilience were purely a matter of personal willpower, we would have by now been broken and completely wiped out of the global map. But we are Africans, because under all that has taken place, causing trauma of all forms and of all manner, yet we are here still, because the foundation of our survival is the drumbeat of our shared humanity and the spirit of collectiveness rooted in the ancient, powerful concept that drives the Kenyan community, the concept of Harambee, where the principle of collective effort finds its truest expression. My message today is a call to action. Let us recognize, reclaim, and reinvest in the original infrastructure of our African healing secret, and that is the community itself. The pathway to true wellness is not a solo track. It is a communal highway paved by the power of the people pulling together towards getting a solution to all the individual and communal challenges. When a crisis strikes, it rarely affects a single person in Africa and in particular in Kenya. It wounds the soul of the entire village, the community of people living together, and the nation. Our response, therefore, must be equally comprehensive and collective. This is why community-based trauma care, CBTC, is not merely a supplemental strategy. Rather, it is the most essential, culturally relevant, and sustainable pathway to long-term wellness. And having said that, let me tackle these few thoughts as the key benefits of the Kenya African CBTC model of let's all pull together, Harambee. Number one major benefit of pulling together, bringing the community together in times of tragedy and in tackling traumatizing crises and episodes. Number one benefit is that it helps in reclaiming the spirit of Harambee as the therapeutic tool. Harambee is not just a social structure. It functions as a therapeutic model. It creates the sense that an individual's well-being is inextricably linked to the well-being of the collective. In the context of trauma, this means that there is destigmatization of the person. There is nothing to be ashamed about. There is no judgment. But in individualized care, seeking help can be seen as a sign of personal failure. But rather, in a Harambee CBTC model, community-based trauma care model, the act of shared vulnerability within a trusted group is normalized and celebrated as a step toward communal restoration. The next benefit is the form is accessibility. It's accessible, it's sustainable, it's reachable. And the former mental health infrastructure across Africa is critically under-resourced. The ratio of psychiatrists and clinical psychologists to the population is staggering. The Harambee CBT bypasses this systematic constraint by leveraging existing and readily available resources, which are peer support networks. This is where training trusted community members, mothers, respected elders, religious and leaders and teachers who are actually the first responders to deliver psychoeducation, psychological first aid, and basic counseling. These individuals are readily accessible and speak the local language and understand the cultural nuances or variations of distress, meaning these first responders are the first peer support network, and it is well integrated in this spirit of Harambee, where something happens and immediately the alarm goes that such and such a thing has happened to someone or in an entire group of people. The other one is it acts as cultural anchors by utilizing indigenous healing practices such as communal grieving rituals. Like now, we just lost the most iconic political leader in Kenyan history. And the grieving rituals that are happening and the traumatic loss, especially for the family, that tragedy currently, if you are able to watch across the news in Kenya, you find that the grieving rituals has been taken by the community, even the entire nation. And the next one is therapeutic storytelling circles, where narratives of pain are transformed into stories of shared strength. There's music, dance, and spiritual rites. And these are not relics of the past. They are powerful, proven, and effective trauma processing tools. The other benefit of communal trauma healing approach is that it moves from being individual wounds to social justice, meaning once there is a traumatizing incident or episode, as a community, when it is taken as a community initiative, it does not only address the person or the persons who are affected, but it becomes a platform for social justice, where people begin to agitate and campaign to bring about social justice. So the Harambee CBTZ is inherently a social justice movement. By mobilizing communities, we equip them not just to heal the wounded, but to advocate for change. When a community collectively recognizes the source of its pain, it gains the collective agency. You become agents to demand safer environments, economic stability and equality, and justice, which are the main factors that prevent future trauma episodes. In conclusion, we are and must be the architects of our own healing. Let us therefore leave this conference not with a plan to import more expensive Western-based healing methods and sophisticated drugs, but we live with a commitment to cultivate more resilient groups, villages, and communities. The pathway to wellness for an African global perspective is not found in complex prescriptions, but in the simple, profound wisdom that has sustained us for generations. We heal faster, we heal deeper, and we heal permanently when we heal together. The power to transform trauma healing approaches does not lie outside of us. No, it lives in the laughter of our neighbors, the wisdom of our elders, and the unbreakable bond of our shared spirit of Harambe. Next slide. Next slide. Let the community, let the global community follow the African pathway to wellness, where every member is a therapist, every gathering is a healing session, and the community itself is the cure. And my final remarks, because one of the speakers just said that African, we are notoriously religious. I want to leave by quoting Ecclesiastes 4:9 from the good book, where as a trauma coach and as a religious leader, and I engage community in this, I base it on Ecclesiastes 4, verse 9 to 11. From the New Living Translation, it says, 2 people are better off than one, for they can help each other succeed. If one person falls, the other can reach out and help. But someone who falls alone is in real trouble. Likewise, 2 people lying close together can keep each other warm, but how can one be warm? A person standing alone can be attacked and be defeated, but 2 can stand back to back and conquer. 3 are even better, for a triple-braided cord is not easily broken. I submit. Thank you for your attention. From Kenya, we say, thank you, asanteni sana.
Asante to you too, sir. That was such a beautiful presentation. We commiserate with you and the people of Kenya for the passing of Raila Odinga. We do hope that God gives you more leaders with a heart for the nation. Thank you so much for your beautiful presentation. We heal deeper when we heal together. Thank you so much, Pastor Steve. I think you should stay on because right now we're moving into the panel session together with Dr. Merino. So I will bring in up all the speakers. Please, if you are on here, please turn on your cameras because I'm pulling you up right now for the panel session with Dr. Merino. Okay. Pastor Steve, your camera is off. And
yes,
Professor Merino is here. So please keep your cameras on so I can bring you on.
Now, you all don't go to sleep on us. Make sure, I know it's been a long day. You know, get your coffee, your teas, your water, and let's participate. All your questions are going to be answered now. So please make sure that you wake up and wake up your friends too, okay? And those of you who are on the panel, shout out to your communities to join us, okay? Because I know it's been a long day, but we're going to finish with a bang. So is there anybody else in the waiting room that needs to come up?
Yes,
Esther,
I see.
now put me in. Yeah, thank you.
Okay, Mrs. Alexander is up. Dr. Nayet, is she still here?
Elizabeth,
Dr. Fola Rogers needs to come up. Dr. Fola Rogers, you're up. Please turn on your camera.
She's on, ma.
Okay.
Why are there 2 of her?
Yeah, it's on.
Jumoke
It's
is
on.
there. Dr. Rogers, you might want to mute yourself because we can hear you. Dr. Samba is there.
Yes,
Okay.
ma'am.
All right. Excellent. Okay, so these are the ones that were left. All right. Hello, everyone. Thank you so much for joining for such powerful presentations. I'm telling you, amazing. I need the questions that have been asked online. I think Busayo or one of you's been collecting it. But before we do that, can you guys? It looks like this thing is frozen. Are we on? Are we still
We
on?
can hear you, ma. Go ahead. We can hear you. We're on.
Okay.
Can hear you.
So, where's Dr. Sambe there? Dr. Sambe, is he there? What happened to him?
I think he dropped off. As soon as he's back, we'll bring him back up.
Okay. Yeah, I think people, this is part of the trauma we're talking about. Well, even you can't even, the network doesn't even allow you to rest, it's on and on. All right. So, okay, he's back. Let's add him. Please, if you have your phone on, you can put them in silent, since we're going to be all talking together. All right, so put your phones on silent, please. And this is only going to be just for a few minutes. It's going to be for like 30 minutes. We're going to have this conversation and then we'll be done for today. I am so glad to be with you, with all of you. Jumoke, Mrs. Jumoke Dada, thank you so much for that powerful presentation on family. One of my specialties is family systems. And because if you heal a family, then you heal a nation. And you really presented that so powerfully. Can you tell us? Somebody needs to mute themselves. Can you tell us, from your perspective, the traumas that happen in families? There's a lot of this. I think you touched on it, the family secrets. When we're talking about secrets in the African context, how do we break that whole diabolical trend that we have, and that's holding secrets? And how do we decide that enough is enough? If you see something, say something. How do we begin to demolish that? Ms. Jumoke Dada, please speak to that.
Okay, thank you very much, Prof. So I wasn't able to discuss about the what's it called now, the therapy, because most of the speakers already did. The first was psychoeducation. It's always good for family to be educated on trauma-informed practices within the family systems. How do I mean? For example, it starts with creating a safe space. In creating a safe space, you realize that many things would be destigmatized, most especially silence. Because if you understand the impact of what silence does to the family, for instance, in the case of maybe a physical violence amongst parents, and the children are being told to keep quiet, not to disclose to extended family members, to neighbors, and all of that. Or in a situation whereby an inflicted spouse with body marks is asked to keep quiet and she lies about it. Yeah. In a situation whereby the family is being educated on the effect of all of this, the traumatic effect of silence and all of that, then they begin to have conversation. It doesn't mean that you have to go out there and start having conversation about everything going on in your family. It just means that as a family, you come together to brainstorm, to discuss, to have conversation around what is happening within the family system, within the cycle of family. It starts from there. It could be that probably the mother brings the children together. They have a conversation around, okay, what dad did is not right, or father brings the children together, or the children comes together to have a conversation on what is going on around their parents and all of that. And if it is in an environment that has been created to be safe, these children will be able to speak with their parents, to sit them down and have like a family conversation. I recall growing up, one of the key lessons I had learned from my parents is whenever they have any disagreement, they bring it to the family meeting and we are asked to be the judge. And one of the things that taught me was conflict resolution, because we all brainstorm together as a family to say, oh, Dad, what you did is not fair. Mom, what you did is not fair. You know, we're able to talk, and it also makes us feel involved in the family system, in what is going on in the family. You understand what I mean? So it starts with psychoeducation of trauma-informed family practices, you know, creating a safe environment where everybody feels seen, everybody feels heard, everybody feels valued, loved, and there is no judgment. Because in all of these, there are situations, for example, maybe a female child gets pregnant, or a son impregnates someone outside. The child is able to come home to a family to have a conversation, and the conversation is not around, why did you do it? You will die today. I will send you out. It's around, okay, you've done it. It's not nice. You've not done the right thing. So how do we move from here to there? You understand what I mean? So it's just having an education, creating, you know, having a trauma-informed care practices where you can have conversation. And in having this conversation, people are beginning to speak up. They are beginning to talk. They are beginning to express how they feel. They are not judged. They are not misconstrued. You are able to ask questions even when you feel misunderstood. You are audacious, you are courageous, and all of that. And also avoiding practices that can re-traumatize a family. So yes.
All right. Thank you so much. Yeah, please. Honestly, so basically, you're saying the core of what you've said to us today is that, you know, families should be trauma informed. And you also talked about this whole idea of family meetings, basically family dinners, you know, family meetings, family lunches, those kind of things where we can begin to rebuild our foundations. So thank you for that. Esther has a whole bunch of the questions she'll come and ask that have been asked online, but I want to talk to Dr. Sambe. Dr. Sambe, you really challenged my Yoruba-ness today. I am telling you. Oh my goodness. I felt, you know, I listened to every single proverb and adage, and the way it just flowed out of you. Thank you so much for adding that. You know, I grew up in, my first few years was in Lagos Island. We grew up there, and you know, there are days when they have
Agbole sort of. You remember Agbole?
Yes. And they had this thing called Oro, right?
Yes.
They had this thing called Oro, and I never knew until today what that meant. You know, because then you couldn't come out, you couldn't do anything, you just have to stay in your house. So today I learned that from you. Thank you. Now, the question of pathology. The question of pathology that's up here is this. It says that where's this? I'm sorry. They say like when the question is how do you localize psychoeducation when most people still see counseling as taboo in our culture? Dr. Sambe.
Thank you very much. It is not as if the community is seeing counseling as a taboo. It is those who have possessed the skill of counseling from Eurocentric regions or via skills of English, who now posit themselves in a grandiose posture, blowing grammar. Just as you know too well that in the American community, it is now fashionable for anybody who wants to seek psychotherapy to pursue that psychotherapeutic intervention via African psychologists or African American psychologists than American psychologists, because such individual will be able to relate at a lateral level not master servant, I better pass my neighbor mentality. So as I speak with you, I can tell you for free that the larger community, including Alfas, the Muslim cleric, they have sought the intervention of my good self right in offer on this table that I am sitting. Because I have appeared on several radio channels or sessions where I was able to speak the language that they can relate to. And you are a typical example too, that you have acknowledged the Oro thing. But if an average person who wants to blow grammar and whatever, it will be like Kilele. So what's this saying? It's not part of us. Thank you. You know, just as bad Enoch had gotten a bad knock, you know, thank you.
Okay, you're just one of my favorite people. Now, look, thank you for that. Now, there's a question for, is Bukola Inde there? Bukola Inde on there? Okay, then I think Mrs. Grace Alexander, you can take this. It was for her, but you can probably take it. All right, so it says, I have a disabled child in my church whose parents...
I'm here.
Oh, okay, good. Both of you can take it.
All right.
It says, I have a disabled child in my church whose parents are in the church choir. The child has speech problems. He cannot speak with one deformed hand. The child, a boy, is about 7 years old, who loves to conduct the church choir, but the parents try to stop him. How can this boy be helped to achieve his goal of becoming a music director or choir coordinator? Actually, I guess it was addressed to me, but I'm giving it to both of you. You can go first, Miss Alexander, and then Bukola will go next.
Yes, in Christendom, there is still a lot of stigma that surrounds when you're a parent, and I've seen so many examples. And people with disability, even some people, when they are praying, they will say, "You better thank your God that you have eyes to see." For me, that's a form of stigma. So anybody that is visually impaired will not come to that church anymore. If you are not lucky that you have a child that is not epileptic, and they still see, even in Christendom, they still see disability as a form of satanic attack. That is a spiritual attack. And there is a lot of orientation that has to be done. Now, I do that. In my church, we've oriented a lot of people, and I go to churches to talk about awareness about the fact that the Word of God says you are created in God's image. You are fearfully and wonderfully created. That means everybody is unique. And there was one I spoke about the fact that recently, during our family month, I spoke about that most parents, we always imagine that, oh, the child, when you are pregnant, you imagine a neurotypical child. That the child has to be an engineer, the child has to be a doctor, But at the end of the day, if you are entrusted with a child that is not neurotypical, what do you do? How do you now trade that child that you are imagining and to a child God has entrusted in your care? How do you want to bond? How do you want to protect the rights of that child? How do you see that child? So one of the things I told them is that at the end of the day, the Bible, your mindset has to change. And that's my story, in the sense that my child started having epilepsy at the age of 7. I wasn't in Nigeria, so it was not like a satanic attack. And I was like, what's this? That went on for 7 years because fear, the stigma, the environmental factor, that's the stigma, affected me. And I was thinking the fear of the unknown, how I lost so many things. Then there was family dynamics as well. My husband said, let's go and do a DNA. After 7 years, I was shocked. And that was the dilemma. But at the end of the day, what made a lot of impact to me as a Christian reading my Bible is that when we are created, I can remember vividly, I started crying. That so you are the image of God. One, your mind, your perception must change in order for you to heal. There was a problem. I acknowledge a lot of pain, anger, shame, but I had to deal with that and that is where acceptance is power. Because when you accept something you cannot control, I learned to give the control of what I cannot control at the altar as a Christian. That works for me. And that works for me. So at the end of the day, any parent, one thing is that in that church, I believe they still need a lot of awareness. They still need a lot of knowledge, because one thing is that people don't realize that what you see is not the reality of that thing. And how you see a situation does not, if you see a situation as really bad, it doesn't seem bad after all. And I can testify to that as a parent of a wonderful young man who is so special, and who light illuminates the world, who has allowed me to become who I am today. So I applaud myself. Thank you.
Thank you, Auntie Grace. Of course, the champion. Let me tell you something. You make it look so easy with the way you deal with Prof and the way you do your life with them. And I know it hasn't been easy for you. So thank you for sharing that, and thank you for showing that there is life for caregivers. And you have been that for 30 years now. So, and you're still here shining and beautiful. So thank you for that. Mrs. Bukola Ayinde, will you please add another component to this? You guys limit your responses to like 2 minutes. If not, we're going to be here the entire evening. 2 minutes, please.
Okay, so to answer the question, what can you do to help the child?
Yes.
The first thing you need to do is to be friends with the parents. So come from the aspect of, oh, yes, your child has disability, but you know that God loves your child. You're in the church, so you have to come down to their level. It's faith-based. So you're going to come from the aspect of faith. Do you know that God loves your child and God wants to bless your child? Then that's one aspect. You talk to them from the angle of, oh, Jesus can heal. But, until the healing is perfect, guess there are things we can do for this child. The second thing you will do is to show the parents children with disabilities who have gone on to do great things in life. We have so many examples. Thank God for TEDx. Thank God for YouTube. You can show them that your child can do this, your child can do that. They'll be like, really? Then if you're truly empathic and you want to go the extra mile, you could just go beyond yourself to volunteer once in a while to sit down with that child in service because parents are usually burdened with caring with children in service. So if you want to go an extra mile, volunteer to be with that child to learn what the child needs to learn. The parents they are actually dealing with shame. The major factor here is shame. Yes. It's an underlying thing. Oh, all the children, I had to get beyond that. I have a child with cerebral palsy. For me to go to church as a Christian became, all other children are able, then you're willing your child into the junior church. So you need to help them step in, and I believe that nothing is impossible.
Thank you so much. Thank you for making it brief and powerful. So be friends with them, volunteer with them, normalize it, basically. Thank you so much. There's something that was said earlier about how do we
Sorry, Professor Marino, can I just add one or two things?
Okay, go.
You can support the parents by letting them understand or know where they may take.
Network has struck. Okay. All right. So the next question, if it comes back, we'll get it. If not, the next question. In recent times, are you all listening?
Yeah.
Can you all hear me is what I meant. In recent times, storytelling is getting, I thought I was listening. That's what I say to my students. Sorry. In the recent times, storytelling is getting eroded, or for lack of a better word, it is fading out of our culture. The question I want to ask is, how can we bring back storytelling into the cultural setting? How do we bring that back into the cultural setting? Who do we have on the panel?
I can take that.
Yes, Dr. Rogers, go ahead.
Yes. Like I said, from the word go, storytelling has been part of our culture, but it is gradually fading away. When we were young, we had so many books about the tortoise, about this, about that, and those books were actually recommended in schools. So there are so many ways to look at it. Let's start with the home. A lot of children don't even have the opportunity to interact with their parents. We talked about elders being wisdom keepers, passing down oral tradition. We need to sensitize our people to allow our parents to interact with these children. A lot of homes, they would exclude their mothers and fathers. I mean, grandpas. So starting from home, we have to let the parents play this role for us. We don't have the time. Most of the time we're in the office, we're out and about, and nothing is even given to the grandparents to do. That is as far as home is concerned. In terms of the system, the systemic structure, Alawiye books and many others at that time were part of what we learned from in schools. We need to encourage people. We need to encourage more authors to go back to our culture and find out what books can be published and how can we push that into the system so that it doesn't just fade away. Take the situation of language. How many of our children are speaking our languages in our home? And how can you tell a story without incorporating your language? How would they understand some words? You talked about Dr. Sambe giving us meaning of some adages and all of that. How many of that can we get? We just need to continue to sensitize the public, come together, know that storytelling is an integral part of our lives. In our therapeutic work, especially myself, I have worked with storytelling, improving the lives of my clients, of my patients. And
thank you.
Yes.
Absolutely. Thank you. Thank you. Thank you so much. Yeah, it is very powerful. Storytelling is powerful. It is healing. It allows people to process, like Dr. Rogers is talking about, to process their emotions. It allows you to interpret the things to make meaning. It allows you to make meaning, and it allows you to foster a connection with the people who are listening. My grandmother grew up telling us stories. How many of you remember your grandmother? Telling you stories. I can still remember stories and each one of them had a meaning and had a moral to it. So I think that we should start in the home. We should start by asking our children to talk about their lives. Let them talk about their lives. Let them tell you the stories of what happened in school today. Let them talk to you stories about what they're experiencing. That's one of the ways we start. Thank you so much. For the men, tell me, Mr. Folajimi is here. Mr. Folajimi, I want to talk about, and also Reverend Stephen, you're here. I want both of you to speak to this. The men, getting men into therapy is especially African men, into therapy. It's been a challenge. It's been a struggle. Although I don't find that in my practice. I have quite a few men in my practice, but getting them into this kind of work, it can be coaching, any kind of line. Therapeutic coaching or trauma work can be challenging. What can we do as a society? What can we do as a community to encourage more men to be open and transparent, to go into the spaces where they can get healing for the traumas of yesterday. Because to say that the traumas that we experience don't affect us is just, us not telling the truth. There was a man a man came to one of our workshops and stuff, and he said, I want to see you, I want you to be my coach, I want you to help me, and because my wife is always cheating, right? And then he said, my wife's always cheating. His wife was not cheating. The first question I asked him was, when was the first time you were abandoned? All right. And he said, and we came to find out that he had been abandoned since he was 3, 4, 5 years old. He'd been taken from one relative to the other. He doesn't know how to love. He doesn't know everybody he's ever loved has abandoned him, right? And so he goes into this marriage just knowing that that this wife is going to abandon him and reject him in one way or the other. How do we go about healing? Because trauma of the past stays in the present. How do we go about encouraging our men to do this? Because there's a lot of women stuff. There's women this, women group, women this, women retreat, women all of that, and we should do those. What are your suggestions? I'll have Mr. Jimmy Kudi to start, and then we have Reverend Stephen follow. Go ahead.
Okay. Well, thank you, Prof. I think just before this, we talked about storytelling, and I think that is a good place to start. I'm not sure we hear enough about how, Prof, you're doing a wonderful job. But the reality about how pervasive trauma is really hasn't dawned on a number of people. We do a bit of premarital counseling in our church, and one of the things, because myself and one of the other counselors in premarital counseling, we try to look out for some of those things. You might find a young man interested in a lady, and then they're having some issues, and you can really, after a while, trace it to some background trauma that has gone unacknowledged. So I think it's the work of JAWS, the work of other advocacy and all that, letting people know that it's normal, letting people know that you're not different because you have experienced trauma. You're not any less a man because you have gone through this. It doesn't dent in any way your masculinity. I think those are the messages that need to be sounded clearly.
Thank you. So basically normalize it. Like normalize it. Like you're not, and this is happening to everybody, right?
Yes.
Yeah.
Yes.
Thank you so much. Reverend Stephen?
Yeah, well, Prof, and I agree with my brother on normalizing. If you're going to get men to open up and also come on board in this in this world of trauma and psychosocial education and awareness, and I would put it that one of the things that needs to be done to men, and it's for men and also for women and also for institutions that deal with such matters, to understand that one of the ways that makes a man be receptive is, number one, when you validate his feelings, his circumstances. Once you validate, his heart begins to come closer, and you make that person begin to open up, because most of the time men are judged, and we have that notion that we are prejudged. So therefore, validating their condition, their feelings, and normalizing it, it makes it easy. The other one I would say is be it who is handling it. Men will listen, and they are going to be able to speak out and maybe borrow this idea of also becoming trauma healers if you're going to show them respect. Men thrive on respect. A small hint of disrespect, disregard, they just shut. And maybe finally I would say, the other thing we say is, if you touch a man's pocket or their economic empowerment, you touch their heart. If there is something that can be done around men empowerment in group form, in individual, because most of the traumas that men go through, it is in the area of their work and the area of their relationship. Like the one you just talked about, talking about their wife maybe cheating and all that. It's about relational. So if you're able to tackle the relationship in a man's life, and also be able to seem to give an answer in the area of their economic empowerment, then you're good.
All right. Thank you so much for that. And so basically, but let me push back a little bit. It's not even pushing back. It's just digging a little bit deeper. So, I've heard a lot of men say this, and I think you've said it again today, that men like respect, right? And if you touch, and if you show a slight disrespect to a guy, then you probably to a man, you've probably lost you lose him, right? And I think that those are all reactivity, a reactive brain, right? So because if you have a trigger point, it means that there's something there. You understand? It means there's something there. So to me, it's one of the reasons why men should start talking about these things. Just because somebody doesn't talk to you a certain way or disrespects you in a way that you are feeling disrespected, it's not about that other person. It's what is in me that's causing me to be triggered. Does that make sense? Like, what is in me that's causing me to be triggered? Because if you come and disrespect me, that's not my problem. That's your problem. So I think it's a reason why men need to be talking to each other. How do we get men to talk to men? How do we get men to talk to men? You see, that's another thing. How do we get men to start talking to men? Because a lot of women are doing this work, but we need men to start doing this work. Dr. Samba is now here. Can you speak to that too? How do we get men?
Thank you very much. I have been itching, but I have to be very careful. Thank you very much.
Well, you got 2 minutes.
I'm sure. No, I will use less than 2 minutes. You know that the male is wired differently from the male.
Correct.
The female is wired emotionally, and the male is wired rationally. So to this, they are essentially gender-based systemic posturing. It does not mean that a male doesn't have emotions, no. But the reading, and more often than not, let me give you a basic Afrocentric based.
Oh, is it gone? Are you still there?
It's frozen. I think it's his network.
Oh my goodness. Okay, well, we're gonna move on.
Maybe I can add something little.
Okay, add something, please. 1 minute. Go
Yes,
ahead.
on that area of respect. For a man, he said about men being rational. Men just want to have something reasonable. if you're going to approach a man or approach a group of men, you really have to have something concrete that you're telling them. And also, the area of respect moves in different dimensions, because if you bring a 20-year-old man in a group of 50, 60, 70, the older group feels disrespected, especially when you are sharing about these issues. So also understanding the age group, and in Africa, that one especially, the age group is something big. You can lose respect. I mean, a man may feel respect is lost if maybe what you want him to open up, you have not regarded the age gap and the age grouping. Such things, the first approach when you meet them or you have met that person, that one alone tells you much about the respect.
Thank you. We're gonna ask you all to come back, including Dr. Sambe, for the men's month, and we can have this conversation in depth. Thank you so much. I want to bring Senchi. Senchi, are you there?
Yes, I am.
Okay, Senchi, this is a different type of question. This is a question that's been asked, and the question is, how do I go from where I am right now in the university studying psychology? I want to be a trauma informed person. But what happens after that? How are you getting because you said you're working in Kenya. So they want to know, how are you getting jobs? Like, how are you getting clients? How are you getting things? So that's the question for you, Senchi.
Okay. So one of the things that I was exposed to is how to come up with a business plan in the Jazz Institute when I went through the course. And part of that is to be able to link up with clients. I'm still working on it. I'm not completely done with it, but there are many platforms that you can access people, even just around you, right around you. Having conversations with people. In the course of having conversations with people, you're sharing your life with them. You get an opportunity to discern that something is fundamentally wrong with this individual. So you can even start with just the people just around you, because in listening to people, you hear that something isn't right, and you can probe further and see if you could engage with them if they're interested in going the long haul. So I would say start with your immediate environment. There are also many other platforms. If you're on LinkedIn, it's a platform that you can use to advertise what you do, the skills that you have, to be able to say, I have these skills. If you need help with, you have a traumatic situation, you need help, you can speak to me, and then give them access to you, how they can reach you. And so the opportunities in the tech age that we live in, the opportunities are limitless in attracting people to seeing what you can do, publicizing what you can do, and them having access to you and going the long haul of finding treatment for trauma. I don't know if that helps.
It helps a lot. And honestly, the other thing is just keep learning. I tell my students this all the time. There's research has not stopped. We're learning new things every day. This whole network called the human network, the human body, we still haven't learned everything about it. We haven't learned the way we do trauma work now is different from the way it was being done decades ago. You understand? So new things are happening every day. So keep learning, and keep practicing. Keep learning, keep making, adding to your network. Just, don't wait for somebody to invite you. Make sure that you also are proactive in the things that you do. All right. And apply for things. I'm always for ask and you shall receive, seek and you shall find. If you don't ask, you're not going to receive. So ask for things. When they're asking you to fill out those form online and you don't fill it out, then you don't get from that. So they're saying they're offering this for this program, and you don't turn in, you don't fill it out. So fill out those applications. You never know where it's going to lead you. Thank you, everyone. We're going to round up now. Everybody, we're going to go around and just give you a last word for tonight before we all go away. So we will start. Just go ahead and you don't wait for me to call you. One person go, and then we'll move on to the next person, please. 1 minute, please. 1 minute. Or should I call your names? You're waiting for me to call you, so I need to put my glasses on to call you. Okay, so we'll start. Wait, Bingpe, are you there? Bingpe, can you hear me?
Yes, I can. Can you hear me?
Oh, finally, Leo Bingpe, let's clap for her. She has been struggling with network. Oh, God bless you. Oh my goodness, she made it on. Oh yeah. You're gonna give us the final closing. Okay, I'll get to you, Mr. Alexander.
All
1
right.
minute.
Will say is that the good news is that there is healing. No matter how far, whatever you have gone through, nobody. Life is full of uncertainties, and what I'll say is that don't live a default mode. Don't live. You have that light within you to shine to the world. So connect with the people. Don't hide under the atmosphere of trauma ecosystem, but look for help, seek for help, acknowledge your pain, and move on. Life is good. I'm a testimony.
All right, thank you so much, Pastor Steve, Reverend Stephen.
Yeah, thank you so much, Prof. My final words would be to my fellow panelists and the global audience that's watching from different forums. I would say this: join a community. Don't die alone. Encourage, enlighten, and empower. Thank you.
Excellent. Thank you, Reverend Stephen. Thank you. Say hello to them over there in Nairobi. All right. Can we have is Miss Jumoke Dada here? Final word. Oh, you have an echo. Okay, final word, please.
Okay. I just want to encourage everyone. We've been speaking so much about trauma. It's time we start talking a lot about therapy, because therapy is important. That is the way forward, right? So I just want to encourage everyone to be courageous enough to seek help for whatever it is they are dealing with, and they should also normalize trauma. Everyone is dealing with one form of trauma. It's not just all about you, it's about every one of us. So be audacious, be courageous, be bold enough to seek therapy.
Oh wow, there's an echo. All right, thank you so much for that. For all you have shared with us tonight. Dr. Fola Rogers, are you there? 1 minute, last word, please. Dr. Fola Rogers, you are muted.
He's on.
Okay.
Can you get...
Okay.
She has two devices on, so she has to turn one off. So we can move on to
some. Turn off one of your devices.
Yeah.
That's why we're having that echo. All right. Well, I don't think she's ready on network. Is there anyone else I haven't called? Okay. All right then. So I want to bring up Mrs. Bingpe.
There are two people on that you haven't called.
Hello, I'm back
okay,
now.
There you go.
Can you hear me?
Go ahead. Who haven't I called?
Can you hear me now, please?
Yes, we can hear you.
Hello.
Oh, yes, we can hear you. Go ahead and speak, please.
Hello.
Go ahead and speak, please.
Oh.
Okay. We can hear you, Dr. Rogers. Okay. All right. Pastor Jimmy, can you please go ahead? Last word.
Okay. What I'll say is trauma can be silent. We should all be as alert to those around us. It would help to be trauma informed, but let's just be observant. Let's be alert. Let's ask questions. Let's check in on people. Let's try and go deeper with people. And those would be my final words. We can all help
All
each other.
right. Thank you so much. Thank you so much for waiting through this whole thing. Thank you so much. Cynthia, did you already give your last words?
No, I didn't.
Okay, go ahead.
I think for me, it's very inspiring today. And what I think is that Africa's healing is right here in Africa, and we can extend healing to everyone that we come in touch with. Yeah, thank
All
you.
right, absolutely. Africans really healing is right here in Africa. Absolutely. This whole thing about we are because I am. You know, we are because I am. That is really powerful stuff. So it is important. Dr. Rogers is trying to get back to the stage. Bims, can you find her? Okay.
Yeah, can you hear me now? Thank you. Can you hear me?
Find who?
Yes, thank you.
We can hear you. Your final
I think
words, please.
network.
Final word is
1 minute. Yeah.
Personally, and I will bring in my co-authors who wrote the book. We all need healing. We want to say that we want to see the whole world heal from trauma and mental health experiences. Thank you.
Thank you so much for all the nuggets that you've shared today. We appreciate you so much. Have a good evening. Okay, Mrs. Binkpay, you have been part of this whole thing today behind the scene. You've been, the only thing that matters is that we did it and it's successful. So you should be proud of that. All right. So I want to first of all thank your team, Esther and Omalayo for emceeing this so well, for Busayo behind the screen, Olayemi behind the screen, Olawale behind the screen, Kenneth behind the scene. I appreciate that. I have the best team in the world. I love the work that you do. I appreciate you. Thank you for all of this year has been tough for me myself, but you guys, I kept on, keeping on. So I appreciate you. Now give the final word and we're done.
Okay. Well, you've literally said it all, but there's no way that we can bring it all to a close without me expressing my own appreciation to each and every one of you for being a part of this very, very, very pivotal conversation. Now, one thing that rung out to me that literally practicalized what we've been talking about in terms of trauma care is the patience and the understanding that we have displayed in the midst of the many challenges of network, of power, and internet connectivity. Look, that for me is remarkable. And that knowledge, that display actually warms my heart and gives us credence that, look, we really, 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 really need to get psychoeducation going on. I would like to say a big thank you to our speakers, your expertise, your insights. And for some of us, I know that, the timeline and everything, you guys have really been so beautiful. As you have shared, one of the things that came up to the fore at this conference is the complexities of trauma care, the complexities of it, and the significance of cultural relevance. That is also important in our communities. Your dedication to advancing and understanding the support systems to put them up for each and every one of us, for your communities, has been truly commendable. To our moderators, Esther, Omolayo, you guys, beautiful. Your guidance, the way you connected all the sessions to flow into one another, Thank you so much. To our attendees, to the audience, look, you guys, your participation, your engagement, the comments also brought about an enriching experience for each and every one of us, even right here in the studio. So what I just want to let us know is, as we move forward, as we move away from this point, from these conversations, let us carry this momentum into our families. Let us carry it into our communities. Let us carry it to our workplace. Our workplace is a community. Let us carry it to our churches. Let us carry it to our mosques. Let us carry it to the very places where we do life. Let's continue to prioritize trauma care and support. Let's foster a trauma-informed culture, right? It is a trauma-informed culture that esteems compassion, that esteems understanding. It is that culture that builds resilience. And that is one thing that we need now in Africa. So once again, thank you all for your presence, for your contributions, for your commitment. Together, we are making a difference. Believe it. Together, we are making Africa trauma-free. That is the goal. That is the vision. And until we meet next time, be well, stay well, and keep on shining. Thank you very much.